Hello, hello. Good morning, fibromyalgia friends. We are excited to have you and welcome you to the live stream. Please come on in. We're going to start the presentation shortly. Let us know where you are tuning in from and give a shout out to all of the panelists that are going to be speaking today. We're excited to host you. We will be starting the presentation shortly, so stay tuned.
To the last 10. I ran away with my life, fast forward, never turn back again. It's kind of funny that the more we pass time, the more we need to set the rewind. And 19 was the year I had to leave you, but now I'm seeing all the signs. Is this really happening? I can't believe it's true. I'm just as surprised as you. This really happening? I can't be too sure, but one day I'll be yours again. Life lessons come one in a dozen. The other 11 get something from nothing. I sit here looking for an answer. Maybe the biggest question was in the last chapter. You gave me the soul I have today. Without you I never could have moved away. But now I see what you teach. I do believe I always should have stayed. Yeah. Is this really happening? I can't believe it's true. I'm just as surprised as you. Is this really happening?
What's up, my fibromyalgia friends? Welcome to day 3 of the Fibromyalgia Community Conference. Come on in here, enjoy. We have a very special presentation set up for you. Dr. Lenz is backstage and going to be ready to get started. We just want to welcome everybody here. It's exciting to be here and continue this conference for 10 days straight. This conference is hosted by the Support Fibromyalgia Network and, of course, our team Fibro. Support Fibromyalgia is a national nonprofit organization that is focused on patient education, medical education, advocacy training, the expansion of research, and the addition of collaborative care, which includes group health coaching. We're excited to present this conference to you live and all over the internet. We are streaming on StreamYard, Facebook, and YouTube. So please come in and join the chat. I know we have heard that the best experience so far is through YouTube. So all of you out there, if you are looking to watch the stream on a mobile device, YouTube seems to have the best experience at this time. For those of you that see it on the landing page of the Fibromyalgia Conference, you might see the chat in there. If it is covering your view because you are on a mobile device, scroll down just a little bit and you'll see the YouTube icon. You can hop on that and join us here in the live stream, or you can join us directly in StreamYard. So look for that duck logo, and this time you can click that duck. So that duck will take you directly into the StreamYard broadcast, so you can join us live for this. I know we may be missing out on some of the comments in Facebook, so we apologize. Sometimes it connects. We're trying to see everybody and add everybody and give you shout outs as well. So I am Melissa Talwar. I'm the Executive Director of the Support Fibromyalgia Network. I'm also a board-certified functional medicine health coach. I'm excited to get this presentation started. So I'm going to bring up my tag team partner for today, the co-host, the awesome Danielle, to the stage. Welcome, Danielle. Do you want to say hello and let everybody know where you're streaming from?
Hey, I'm from North Carolina. I'm so excited to be here. I'm so ready for today because the things that we're talking about today, I've been researching this past year and dealing with. So I'm just ready to hear what Dr. Lenz has to say, and then later today, some fascia. So I'm ready for that.
I know we have a really long day ahead, but it's going to be great. And there's going to be a lot of educational content prepared. So please do like and share this content with all your fibromyalgia friends out there. We appreciate it, and stay tuned. Do subscribe and like to our channels because we have more content ahead for you. Connect with the guests. We'll be posting links also in the chat so that you can connect with them, find them on social media, subscribe to their podcast, and purchase their books. I do want to give a special shout out to the tag team of Danielle and Danielle for yesterday's co-hosting. This is a lot. We are live. This is an active live broadcast, so sometimes things may happen. You might see a duck error coming up too. Just be patient and come back in if something does happen, because the internet, you never know what's going to happen for unexpected things. But this is why we appreciate what we're doing. And Danielle is here again, co-hosting throughout this day. Special shout out to Michelle from Turning Pain into Strength. She'll be presenting on Thursday, and she's been amazing sharing the content everywhere. I see Carrie. We love Carrie. She's in here and she's shouting out to Fibro Nerds as well, which is a special hashtag. Carrie and Crystal, shout out for doing all the amazing work and supporting us. We will be having a giveaway after Jill, so keep that Fibro hashtag. Yes, Fibro Nerds. So use hashtag Fibro Nerds and put it in the chat so that you can enter the giveaway. When Jill is done with her presentation, we're going to give away some of the herbs. Orbs, maybe later for that. I don't know. But we have giveaways too for books. Dr. Lenz has a book, so we're going to be giving away other things too throughout the day. So stay tuned for that. And come on in, share the stream. And I do want to just get straight to the presentation. Let me pull that up so we can get started and get Dr. Lenz up. Now, Dr. Michael Lenz is unique in so many ways with his background as a pediatrician, internist, lifestyle medicine physician, and clinical lipidologist. He has a vast background in fibromyalgia care. He did recognize that there was a need for more education on fibromyalgia and related illnesses, and created Conquering Your Fibromyalgia, which is a podcast and a book. There's also additional educational resources at conqueringyourfibromyalgia.com. Take a listen to his interviews. Be sure to subscribe to his podcast and definitely enjoy his presentation. So let's bring up Dr. Lenz, to the stage. Hello.
Hey, it's so nice to be here. So excited, broadcasting live from Wisconsin.
Yay, Wisconsin. So shout out to everybody who's tuning in from Wisconsin. So we have California, Wisconsin, North Carolina. That is the beauty of live streaming and going virtual. Dr. Lenz, it is a tremendous pleasure to have you here giving your talk. It was a popular talk last year as well, so we'll have to share that with everyone too. But you have a wealth of knowledge that it was really challenging to try to pick what topic to present on because of your unique background and because of your diverse background. So we're so happy you're here.
Yeah, so excited. So excited to get a chance to present, and on one small aspect, or one short aspect of the talk that I have. Like I said, I have a book and the podcast to elaborate, but this is a topic that I think is going to have a huge impact on a lot of people. Both, as I say, this is meant for people who are living with this. It's for their loved ones who do not have a body or brain that works like this. And it's also for doctors who are also trying to understand and care for patients better.
Absolutely.
I think this is going to be a great presentation. We'll probably have lots of questions afterwards from everyone, so it'll be great.
Well, let me bring your slides onto the stage, and what's going to happen is you'll stay on the stage. So Danielle and I will go backstage. We're still here. If you need us, just give us a shout out, and then we'll be back on when we see the end slide for you.
Sounds good.
Okay, so Danielle and I will remove ourselves, and then you can get started.
All right. Well, as you said, got the unique perspective of pediatrician, internist, lipidologist, lifestyle medicine, and try to weave the best of both conventional medical management along with lifestyle medicine, which is having to do with nutrition, diet, exercise, sleep, stress management, avoidance of risky substances, using that biopsychosocial spiritual model. And the long title of my book and podcast would be Real Answers and Real Solutions for Real People with Real Pain and also real fatigue, which is often more of a challenge than the pain for people with fibromyalgia and related issues, and real brain fog. And looking at fibromyalgia is like looking at this big ball of yarn that is all these multiple colors representing all of the involved intricacies of these complicated fibromyalgia. That's why it's often many people don't want to, as in the medical community, deal with it because it's too complicated and they keep kicking it over to some other specialty, and no other specialty really has any comprehensive understanding of this. So you're left with somebody like myself who has the longitudinal perspective throughout the lifetime, from caring from newborns through old age and in between. And I actually take care of all ages who have these issues, and we'll talk about that today. And the title of this is Fibromyalgia, Chronic Pain, and Other Central Pain Syndromes, and the Connections with ADHD and Autism. We'll start with a patient I saw this summer, and when it was a new patient to me, and before I walked in the room, I always will ask the nurse, like, any special things that they mentioned that they want to go over, just to get an idea that I make sure I cover that. And the nurse said, oh, no, she has no concerns. She's just here for a checkup. Walked into the room, and she was sitting there, and she was wearing a mask. Well, not the mask that you're probably thinking of. She was wearing a smile and greeted me cordially and all of this. And I sat down, and as she had reported to the nurse, she has no concerns and was just here for a checkup. And said hi and introduced myself, and she had no concerns like the nurse had said. But going through her medical record, electronic medical record, she had dysmenorrhea listed in her problem list. And a lot of times problem list is something that is not up to date, right? You might have had a strep throat 10 years ago and it's gone, or you had a hemorrhoid once 10 years ago and you're like, I don't have that anymore. It was a false diagnosis, whatever. So I was going through that, and I said, is that still a problem? And she started to get some tears in her eyes, and she said, yeah. And I said, okay, from like 0, no pain, to 10 being excruciating, how painful are your periods? And she said, they're so bad, Dr. Lenz, I can't go to school for a couple days. And I said, oh, well, a lot of people who have painful periods also have pain in other areas in their body, like headaches, neck pain, stomach pain issues. And then she started to get more tears in her eyes. And she said, Dr. Lenz, I hurt everywhere. And I said, well, why didn't you tell the nurse? Why didn't you tell me that when you walked in? She said, Dr. Lenz, I've been hurting everywhere since I've been a kid. I've been to so many different doctors, pediatricians, and my OBGYN that I've been seeing for the last 2 years said, all that I can do for you is give you birth control. Don't expect any more. I think my mom and a lot of people think I'm just a hypochondriac. We're going to get to her at the end of my talk. Keep you posted. Fibromyalgia and these invisible illnesses are kind of like the tip of the iceberg. And under the surface, there's some things that we often get missed. And autism and ADHD often lie under the surface. They're frequently comorbid. They're rarely recognized by patients or the medical community. And they're extremely important to understand. And appropriate supports can make a big difference. And neurodivergence, not a quote medical term, but it's kind of a lay term that many people have heard of. And the main areas of that are ADHD and autism and other aspects, but I'm going to focus on those two aspects today. And when we talk about autism, I was trained as a pediatrician to consider it in kids in that, toddler preschool area, to pick up these delays in social communication, language, and to really get them access. But what we're understanding is that this actually continues into adulthood. And most people who have it, just like the tip of the iceberg, those are the ones who get identified or were identified if they're adults. Those are ones who had more severe struggles and impact. And now we're recognizing that a lot of this continues into adult life, never goes away, and always has been there when we look for it. Traditional testing, ADOS testing for autism in adults underestimates that because it's a different presentation, similar to how ADHD in adults Doesn't look like a hyperactive 5-year-old. Autism common traits are finding it hard to understand what others are thinking or feeling, getting very anxious about social situations, finding it hard to make friends or preferring to be on your own, seeming blunt, rude, or not interested in others without meaning to, finding it hard to say how you feel. That's called alexithymia. And taking things very literally. For example, you may not understand sarcasm or phrases like break a leg. Having the same routine every day and getting very anxious if it changes. Not understanding social rules, such as not talking over people, avoiding or not preferring eye contact, getting too close to other people, or getting very upset if someone touches or gets too close to you. Noticing small details, patterns, smells, or sounds that others do not, and may have a very keen interest in certain subjects or activities, and may like to call that enthusiasms, and liking to plan things carefully before doing them. In women, sometimes it can look different. They may hide things of autism to fit in by copying people and who don't have autism. Maybe be quieter and hide their feelings and appear to cope better with social situations, but having a lot of internal symptoms and show fewer signs of repetitive behavior. That means it can be harder to tell if you're autistic, which is something that I am noticing a lot in my patients when I'm just asking the right questions. ADHD has 3 core symptoms. There's DSM criteria that you can look up, but if you boil it down to 3 core symptoms to remember, it's an interest-based nervous system, emotional hyperarousal, and rejection-sensitive dysphoria. Interest-based nervous system, despite its name, ADHD, doesn't actually cause a deficit of attention. It actually causes inconsistent attention that is only activated under certain circumstances. People with ADHD often say if they can get in the zone or hit a groove, these are all ways of describing a state of hyperfocus, intense concentration on a particular task during which the individual feels she can accomplish anything. In fact, she might be so intently focused that the adult with ADHD may lose all sense of how much time has passed. This state is, however, not activated by a teacher's assignment or a boss's request. It is only created by a momentary sense of interest, competition, novelty, or urgency created by a do or die deadline. Emotional hyperarousal are maybe things like, I always feel tense. I can never relax. I can't just sit there and watch a TV program with the rest of the family. I got to get up, walk around, and do things. I can't turn my brain and body off to go to sleep at night. And rejection-sensitive dysphoria is an intense vulnerability to the perception, not necessarily the reality, of being rejected, teased, or criticized by important people in your life. RSD causes extreme emotional pain that may also be triggered by a sense of failure or falling short, failing to meet either your own high standards or others' expectations. And this is extremely internalized. It can just hit like a ton of bricks, an emotional gut punch. And ADHD, in connection with key points about people are neurodivergent, ADHD is more common in those who have fibromyalgia and other central pain processing syndromes. Treating ADHD improves ADHD symptoms and fibromyalgia and related symptoms. Autism spectrum is more common in those with chronic pain and fibromyalgia. Most neuron adults are unaware that they are on the autism spectrum or have ADHD. And identifying neurodivergence is important for families, for patients, their families, loved ones, and their doctors. Talking just a simple definition of pain, it's the perception of actual or perceived tissue damage. And pain differences. One study was done looking at the differences in pain experiences between those with ADHD compared to those without. And you heard of the cold water bucket challenge a few years ago? Well, this is called the cold water hand in the bucket study. And I think it's very interesting here. The researchers had the participants put their hand in a bucket of ice water, okay? And they asked these questions. How long did it take to develop pain between the two groups? How long were they able to withstand the cold before they had to remove their hands? So first, tell us when it starts to hurt, and then keep it in there until it's intolerable. And what did they find? Those who had ADHD had less than half the time before they reported pain. And how long they could keep it in the bucket of water was nearly a third of what those who did not have ADHD. Then they did something interesting. You probably wonder, what do they do next? By the way, both groups removed their hands at the same level of pain, which was about 90 out of 100. So they both reported the exact same perception of pain, but it was at a different level. And then they looked at use of methylphenidate, generic for Ritalin, on time to withdraw their hand after the pain. And sorry, it got transferred over my keynote, but 210% longer when they had methylphenidate, nearly normalizing that to those of the controls in that light green there. And how many long did it take for them to report pain also improved or had increased duration. Conclusions and results suggest that people with ADHD are more sensitive to pain compared with controls, and that methylphenidate may exert anti-nociceptive properties in these subjects. How many people with about 30 to 80% of people who have fibromyalgia and chronic pain syndromes have ADHD, and we'll talk about that. And part of that varies on the type of evaluation they did, and some may be underestimating this. A study looking at the prevalence of widespread pain in those with ADHD compared to controls. And what you can see here is that the widespread pain in those with ADHD was up to 80% in one study, and compared to only about 17% of those who did not have ADHD. Another study done in South Africa that many people have heard of, came in the Journal of Pain, showed that 45% of people screened positive for adult ADHD. We're using the World Health Organization ADHD Self-Report Scale version 1.1, which you can get online. That actually underestimates the risk. There's more detailed testing. We'll talk about that. Participants with both fibromyalgia and a positive adult ADHD test screened higher on their fibromyalgia impact score. So that whole episode on that. If you don't know what a fibromyalgia impact score, go to How Bad Is My Fibro, one of my earlier podcast episodes. But that's from a 0 to 100. That's high. And then self-reported cognitive impairment was 11 times more likely to be rated higher in the combined group with ADHD and fibromyalgia compared to the fibromyalgia group without ADHD. 11 times higher rate of cognitive impairment. And as they talked about, the screener is not as sensitive compared to the DIVA 2.0 and 5.0 and the Connor's adult rating scales with the and the screener picks up about 60% of people with ADHD versus about 95 to 99% with a DIVA 5.0 and Connor's adult rating scale. So it may be missing about 40%. So that may be underestimating, as we'll see in some other studies. So when they look at studies connecting likelihood of being autistic in those with chronic GI issues, and this was a pediatric clinic, this is meta-analysis was done. And the overall, when you average out the studies, about 4.5 times more likely to be autistic, or 2 to 10 times more likely to be autistic in those who had chronic GI symptoms. Kind of in kids, think of the IBS, chronic epigastric dyspepsia, chronic nausea, all of those kind of categories. And what they said in the consensus of that study is that experts, parents, and healthcare providers should be educated about possible GI symptoms and pathophysiology in autistic children, and children suspected of having possible GI disorders should be screened accordingly. And then I did a study, just a poll in one of the POTS groups, and it had a big response. And using the RADS which you can get online, and do a cutoff score of 65 or higher is strongly suggestive of having autism. And about greater than 40% were greater than the cut point of 90. And so roughly about half were in that autistic range. And then a smaller group in the fibromyalgia Facebook poll showed that about 50% were in that autistic range. When we look at autism and chronic health, this was an observational study of central sensitivity syndromes in autistic adults. This study investigated the co-occurrence of these central sensitivity syndrome diagnoses and symptoms with autistic adults, and explore whether these central sensitivity symptoms were related to autistic traits, mental health, sensory sensitivity, or sex. And what they did was they had 973 autistic adults in the Netherlands in the autistic registry, and they completed questionnaires assessing autistic traits, sensory sensitivity, and evaluation for central sensitivity syndromes, physical and mental health issues. And this is because these are often connected, and they may express pain differently. What they found in this testing is that 21% reported, just on their survey, that they had a diagnosis of a central sensitivity syndrome. But based on the questionnaires they did, actually 60% were above the threshold for having a central sensitivity syndrome, which isn't completely all of the central sensitivity syndromes. In other words, 40% of them actually had one of these central sensitivity syndromes, but were never diagnosed. And then when we look at prevalence of ADHD symptoms in a clinical sample of children and adolescents with chronic pain, a study using the social responsiveness scale and ADHD scale were used. 14% met the criteria for autism, 20% had ADHD, and there was a combined of 26% having both, 26% and 8% scored cut off for both disorders. Interestingly, only 4.8% had a prior diagnosis of autism, and ADHD was 0.7%. So most of those who had with ADHD and autism had never been previously diagnosed. And then when we look at another study looking at chronic pain and health-related quality of life in women with autism and or ADHD, a longitudinal study. So they asked what happens to girls or adolescent girls with autism or ADHD in childhood and or adolescence later in life. So they followed a group of 100 people. This was done in Sweden so they could track them with their socialized medicine system, see where they live, not as much probably mobility there. And they looked at 16 to 19 years later, and 34 had autism as a main diagnosis. 31 of these had ADHD as a secondary diagnosis. 41 had ADHD as a main diagnosis. Chronic pain was in 77% of the women of the 16 to 19 years later. This is more than 3 times that of women in the general population. And chronic widespread pain was 5 times greater in the autism ADHD group. And the most common locations were chronic low back pain, abdominal pain, and recurrent headache. And when they looked at protection, we look at protection of ADHD treatment on chronic pain, those who had a diagnosis of ADHD in childhood, and then they looked into adulthood, those who were on ADHD medication stimulants, 16% had chronic pain. And those who had ADHD but weren't being treated, 42%. So big difference. The interesting thing was they found there was no difference in contact with a primary care doctor or a psychiatrist between the two groups. And the big question is, why was there a gap in treatment when you have such a big difference? And we'll talk more about that. But it's a good question. Why? Why weren't they treated? There's another study that was just done a year ago out of Israel looking at 52 adults diagnosed with autism and 52 healthy subjects, age matched and controls. And they looked at quantitative sensory differences to assess pain sensitivity differences. And what they found is in the dark blue here, at different temperatures of Celsius, they go up, that those who are on the autism spectrum reported on this numerical pain score from 0 to 100, how bad is the pain, reported on average a significantly higher level of pain for the same level for the same temperature. And when they looked at the differences between the controls, anxiety levels on average were significantly higher between the groups, and their pain catastrophizing score also was significantly higher. And then this PSQ stands for pain sensitivity, and that also was more sensitive. And then there's a sensory responsive questionnaire kind of going along with the autism, supporting, again, a difference that we know. So is that this latter, looking at another experiment here, sorry how it got transferred over to this presentation, but this study basically goes in the face of what many had thought, that people with autism don't feel pain. Actually, there's many of them are much more sensitive to pain. And then when we look at autism in girls and women, it's again usually missed. Now the ratio probably of women to men is about 5 to 8. A study done in Australia, when they looked at the difference between girls and boys with ADHD, the girls rated a higher number of somatic complaints, more body pain symptoms. We look at overlap of autism and ADHD. About 50 to 80% of people with autism have ADHD. Most with ADHD, however, are not autistic. Here's a study done out of Spain in 2011, finding a high frequency of childhood ADHD in women with fibromyalgia. And as you can see, 62% or 32% of them had prior diagnosis. What's interesting is boys are 2 to 4 times more likely to be diagnosed with ADHD than girls as of the study in 2011. And often that's now where girls are typically missed because they don't express as many externalizing symptoms, more internalized. This means that at least half were never diagnosed, and probably the 32%, probably if you were doing more careful assessment, probably could have at least been double that, up to 64%. If a tree falls in a forest and no one is there to hear it, does it make a noise? And well, the question is, if someone with a central pain syndrome walks into a doctor's office and the doctor isn't listening for autism, does it mean their patients don't have autism? Something to think about. ADHD prevalence in a study from the University of Tokyo Pain Clinic. They looked at the percentage of patients diagnosed as having ADHD among 153 consecutive patients experiencing chronic pain who had been diagnosed as having probable somatic symptom disorder, kind of a general pain disorder. I don't use that diagnosis, but they use that for psychology, sometimes referring to chronic pain, and refer to the Chronic Pain Clinic, University of Tokyo, 2016 to 17. And what they found is that 73% had ADHD, and this was based on the more detailed testing with the Connor's adult rating scales, both from the self-report and the observer rating. And then they also did the DSM, using DSM criteria, and at the time, the DIVA 2.0 questionnaire for adults. What's interesting is that some of them, the self-report reported it, but the observer didn't, which means they were masking their symptoms of ADHD. And at times, the observer scores showed that they were in the ADHD range, but didn't, but they themselves didn't report that. So often there's that missed awareness both by yourself, and I see that with patients. And so it's important to be aware of that. How many people, now, they were looking back here, 73% had ADHD of that 153 or 51 people that came in. How many people do you think had previously been diagnosed with ADHD? None. Very sad. ADHD in that study, treatment was given to 60% with methylphenidate or atomoxetine, which is Strattera. More people were offered, but there are some people actually, and I see this in my practice sometimes, where they just didn't believe they had ADHD. Like, I don't care, I'm fine, I don't have a problem, I'm okay. 73% of those who were treated had improvement in their ADHD symptoms. And their average numerical pain rating scale from 0 to 10, how bad is your pain, decreased from 3.5 points from 5.9 to 2.4. That's a mean drop of 61%. Quite impressive. Given that most chronic pain patients are examined by orthopedic pain clinicians, primary care, and rheumatologists who are unfamiliar with ADHD diagnosis, let alone treatment, it is likely that ADHD diagnosis is too often overlooked. The present findings, as they said in the study, illustrate the importance of evaluating patients with chronic pain for ADHD. And the core symptoms of fibromyalgia and chronic fatigue syndrome, which I think are synonymous, are fatigue, chronic pain, executive functioning deficits, also known as fibrofog, and sleep problems. So they did a study out of Australia. They had 20 patients divided into two groups. The patients in the treatment group received 5 milligrams of Adderall, then assessed twice a day, then assessed a week later. And if no benefit or side effects, they went to 10 milligrams twice a day, and then reassessed in a week, and they went to 15 milligrams twice a day if needed. What they found, and then they had the fatigue severity scale, which is from 1 low, which no fatigue, to 7 being very high levels of fatigue on that scale. Both groups had an average score of 6 to start with. And after treatment, the Adderall group went to 4.7, and the placebo group did not change. 9 out of 10 in the Adderall treatment group had improvement in the fatigue severity scale. There was no improvement in the placebo group. And then they used this short form health survey looking at for physical role and vitality. There were much larger changes associated with the dexamphetamine or Adderall treatment than the placebo. And the physical role of another functioning went from an average of 22 to 52.5, which a higher number is much better on this scale. And the vitality score went from 23 to 40. And what about the safeties? I mean, people sometimes, maybe there's a lot of stigma about stimulants. They only had 2 cases in their big clinic group out of 400 that had used dexamphetamine or methylphenidate that used it. inappropriately. And they concluded that dexamphetamine is a promising drug for management of chronic fatigue syndrome. A large trial with prolonged duration of treatment would be appropriate. And then there was a bigger study done, and they looked at those who had chronic fatigue syndrome and ADHD were treated. And it was another larger placebo-controlled study using Vyvanse, that's now generic in the United States, a long-acting version of Adderall. And what they looked at in particular was executive function struggles, which overlaps with fibro symptoms. 15 received Vyvanse and adjusting the dose, similar to the last study. 11 received placebo. And what they found here is that when you're looking at the general composite score of the behavior rating inventory of executive functioning, that after 3, 4, and then by the 5th visit, there was a marked improvement in those who were treated compared to placebo. And then, you can hit the pause button later and go back if you're watching this online. And this is some of the specific scales when they're looking at under that score of the composite score going from 3.36 to 21 with the LDX stands for the generic form of Vyvanse. And then you have all of these other positive outcomes when it comes to cognitive function you can look at later. Fatigue severity scale also had a marked improvement, dropping markedly, as you can see. And then they looked at other things like the McGill pain scale, which a higher number again, improving with the LDX. The fibromyalgia impact score improved. Again, could have been powered and had a more better p-value there. But when of course, the ADHD rating scale improved. That's a measure of ADHD functioning. And then there's a HAM anxiety scale also showed improvement in functioning, which sometimes people think is paradoxical, but many people with ADHD have chronic anxiety, and that's kind of an adult manifestation of their hyperactivity symptoms. The study demonstrated that Vyvanse brought about significant improvement in functions of brain fog, fatigue, global pain, and global functioning. All right, now I'm going to end with the case here that brings home both pediatrics and into the adult. This was a case study done out of Sweden. It's a 6-year-old girl who had chronic pain for 9 months. She had thought was just knee pain. 18 months to 3 years of age, she had begun to have continuous headaches, joint and muscle pain, and started to limp. She avoided bright and noisy environments. She had no relief with pain relievers. She was diagnosed initially with psoriasis, but was proven later not to be correct, and osteoarthritis. Significant history for migraines in both patients. She had been seen at various pain clinics. She had 2 normal head MRIs, neck MRIs, normal labs for rheumatology, Borrelia, Bartonella, thyroid, Epstein-Barr. All of those were negative. Her pain diagram you can see on the right here shows pain in multiple areas, head, arms, legs, and she was given piroxicam but provided no pain relief and subsequently withdrawn. Disappointed with their care, they went to Arizona where they thought she might have Lyme disease. Western blot was positive, but P39 was negative, and a laboratory found 1 Bartonella on a lab slide and treated her, diagnosed her with lymphoverticulosis, which is known as cat stress disease, with 2 months of treatment with azithromycin. The family subsequently went to Germany, where additional testing was done and carried out for Lyme disease, and this was positive both for an IgG and P39 testing. Again, this was normal previously at the other testing, and got another 2 weeks of IV azithromycin and initiated another 3rd week. They went to eventually back to Sweden and got oral azithromycin. According to her parents, the girl's sleep improved some after antibiotic treatment, but her pain did not improve. She then went back to Sweden when she was evaluated by a clinical psychologist. She continued to have severe headaches, joint and muscle pains, hypermobile joints, and hyposensitivity to pain from wounds. Fatigue and temper tantrums felt to be from pain by her parents. Light touch and pressure elicited pain with activities. Social interaction, psychological stress, and audiovisual stimulation by intense light and sound generated more pain. Until age 4, she was not interested in peers or interactive play, uncertainty about rules and roles, especially if there was more than one person, anxiety and resistance to unexpected changes in activities and context, hyperactive during exam and needed to be playing with video games. She had special interests in horses and other animals, and problems getting ready for school and staying in school. A psychiatric assessment was done, and she was diagnosed with Asperger's, which now we would call autism spectrum disorder, as well as ADHD. She was given methylphenidate and acceptance and commitment therapy with supports at school being started. Sorry for this, got transferred over my slides, but the parents got education, structure, foreseeability for the girl, and a contingency plan for support behaviors, personal assistant at school. Continuous improvements occurred. Pain reported 1 night a week versus continuous pain, full school attendance. Mother worked, who couldn't work because she had to be with her daughter all of the time, worked 75% of the time, and parents noticed pain would return significantly without methylphenidate therapy. And here, again, is this what her level of pain was: a 10 before, after treatment, after 6, 3-month follow-up with the 5, and a year follow-up was 1. Anxiety score also went to 0. Depression scores went to 0, and pain-related worry went down. Again, you can hit pause if you want to look at that more carefully. And her pain map, this is on the left side, is what it was before, and then only having pain in the lower leg. Now, so my patient that I mentioned in the beginning, what happened to Sarah? Well, I did a careful history, and she had all the classic symptoms for restless leg, and she had growing pains forever, which were blown off and missed by her pediatrician, and just benign growing pains, and didn't realize that it was actually restless leg syndrome and periodic movement disorder. It was diagnosed, and we titrated her gabapentin, and that got better. We also then did the DIVA 2.0 with an ADHD questionnaire with clinical history that showed ADHD. We started her on Vyvanse and adjusted the dose to find the optimal range. We also did the CAT-Q, which is camouflaging autism traits questionnaire, which also supported the diagnosis of autism. She got education and was started. Also got on consistent exercise, eating more of a plant predominant diet, and talked about good sleep hygiene. She reported within the first month, because we were able to adjust that within a month, she reported for the first time in her entire life, she did not have any pain with her periods. And she had excruciating pain before that. Her fibromyalgia FIQR dropped into the normal range from very high. And she had also improvement in her ADHD symptoms and functioning as expected. So if someone with fibromyalgia and undiagnosed ADHD or autism walks into a doctor's office and no one is there to hear them, do they make a noise? Yes, but we need to be listening, and patients and their families need to be self-advocates. And again, just thank you. I have a lot more that can be said, and that's why I do the podcast. That's why I wrote a book. Right now, as the time has gone live, 126 episodes with 10 more already ready to be published. And if you enjoyed this talk, it does make a big difference to get this out to other people. If you go on the Apple Podcast, leave a rating and review and share that with others. That's where I think I will end, and thank you.
Thank you so much. This is tremendous presentation. I have so many questions for you, and I have to tie it back in to what you're talking about, because again, you have so much in-depth information, especially with pediatrics as well. And I know we have a lot of questions, and please do subscribe to the podcast. You have a lot of great interviews in there covering various topics. You talk about sleep too. Last year you mentioned sleep. You addressed sleep on the conference. So this, Dr. Lenz, I don't even know where to send people to start. Does your podcast actually tell them where to start?
You know, you can flip through like anything. You can flip through the podcast episodes. And I know many may not have enough time to answer the questions. Feel free to email me. Email me at drmichaellenz@gmail.com. And love to have that more conversation about that. We can talk more. I have episodes I've done about autism and ADHD and a variety of other things, and more to come. So there's a lot of overlapping things. So, you can kind of look through. One of my medical doctors told his patient, by Dr. Lenz's book, listen to the first season of episodes and come back and see me in a month, because it's too much to cover in a 30-minute office visit. So, and I guess some of these may apply more than others, right? And I think a huge part of the purpose of the podcast, at a minimum, you're going to be validated. I would imagine that many people out there listening have some very intense emotions in both directions. They're both happy and also very sad and frustrated at the same time, because many of my patients, like this girl that I see in these, she's a typical patient that I might see. Her whole life she's been to many, many doctor visits. It's completely been brushed off. And in one visit, and then short visit follow-up after that. We were completely able to turn her life around by recognizing these things. And sadly, and she's only 20 and she felt sad. You got the 6-year-old girl whose life has changed around. But for most people, they aren't getting picked up at age 20. They've added 20, 30 years to their life who've had these same symptoms, and it goes back often to childhood. So, there's more that can be said, but I want to have a chance for any answers. And I definitely do like emails. I love to hear questions. You can also, those are great topics to talk about on future podcast episodes. So anything we can't cover here, but I'll be happy to go through any questions anybody has.
Well, I'm going to toss it over to Danielle because I know that she has questions as well too, and she's been looking at the chat to help answer some of those questions.
Well, I just wanted to ask first because I know fibromyalgia is correlated with fight or flight, and so is a correlation with ADHD have to do with dopamine and norepinephrine? Is there a correlation there?
Yeah. So at the core, ADHD is imbalance in dopamine levels and norepinephrine levels in parts of the brain, actually likely lower levels in parts of the brain. And so when we talked about the 3 core features of ADHD, the second one we talked about was emotional hyperarousal. So when we talk about trauma, which I'm going to be talking about in 3 weeks on my podcast, I'm talking about the role of trauma. People with ADHD and autism are actually more susceptible to experience trauma for a variety of reasons. Some of that may be impulse control. Some of that may be more likely may be victims of abuse because they don't know how to smoothly navigate social situations. So they may be more likely being taken advantage of and then have horrific, sad things that happen to them. We add to that. And on top of that, if you have this style of a brain nervous system, it's harder to move on from that. Not to say it's easy, but it's much harder to have that. And so you can't, quote, turn off. And one of the questions on the Fibromyalgia Impact Questionnaire, if you've ever done it, if you haven't, it's good scoring rating. I have an episode on that, on how bad your fibro is from 0 to 10, how overwhelmed do you feel? And that is one that when I have patients who have their ADHD not treated, that's often very high. And then when they come back and we've dialed in the right dose, and if they have RLS and all these other things, that often is they're like, overwhelmed? I don't feel overwhelmed. And they forgot that they were, but now that's shifted. It's just a normal state that they had. And now they're like, oh, because there's so many other variables that we're kind of tracking. We often think of the pain, but that sense of overwhelm often is a big improvement with that. So hope that helps in a sense calm that down.
Yeah, that's very interesting. I feel like you have such a broad expertise, and as someone that was diagnosed at a younger age, I guess I'm not sure if you can answer this question, but how could we better support to get more pediatricians to have the expertise and not necessarily to treat fibromyalgia, but just like to look out to diagnose or just to be able to be like, I think you might have this. Let's, do an assessment.
Yeah. And that's quite honestly, I've been doing this, taking care of people with this kind of mindset for over a decade. I've kind of realized that I've been floating down the stream by myself. I'm kind of a weirdo. Not a lot of people I realize actually do this. I get people from the country go, hey, I'm in Maryland, I'm in North Carolina, I'm in California. Do you know anybody by me that does what you do? And I go, I don't. There isn't, quote, a conference where there's with that. And that's why hopefully there's a neutral minded physicians looking out there who just have not had literally any training of this. And they're open to want to learn, just like none of us had treatment on education on learning how to treat COVID. Now people may prescribe Paxlovid for adults who have that. We have to learn. I think sometimes it's hopefully somebody who's willing to learn. And that's actually why the book and the discussion I have with the presentation, it's a high enough level that if a doctor is listening to this, they can go, oh, well, this is good evidence. This is not just anecdotal things. These are actually evidence-based things. And these are studies going back a long time. Kind of the unique perspective is because I'm a pediatrician, many pediatricians will recognize ADHD, but they'll miss it in girls, or that they'll say, oh, she's smart, she can't have it. Oh, she doesn't apply herself. Oh, she's just emotional. And they may miss autism as we're recognizing. And we don't even know these are connected. They may recognize it as getting educational things, but they may not be recognizing that the impact it has on these chronic pain issues as we're trying to connect. And the problem is I guess I've always wanted to learn things in depth and always was curious. And I never believed in hypochondria. That was my premise in going in. There had to be a reason, and I never believed in that. And now I feel like I'm untangling this yarn and seeing how these connections are put together. So I guess getting them a chance to read the book and the podcast, and hopefully that sometimes maybe where a parent has to be an advocate and bring that up to their physician or for their child.
Well, I want to just say and agree with Carrie, you are one of a kind. And talking about pediatrics is so important because we don't have enough conversations, especially when chronic illness conditions develop earlier in life, as both Danielle and I have both experienced. And then even from your conversations with Fibro Connect, shout out to Lee for running an amazing group. And I know you're interactive in there. We've talked about restless leg syndrome, but also growing pains came up a lot in our conversation too. So just strategizing on the pediatric side overall is going to be important. Dr. Lenz, we may need to have you teach some of the pediatricians how to recognize all of this for our sake.
Well, and I'm connected with our internal medicine pediatric residency programs. I've worked with residents in training. And it's funny, my resident who I do 4 years with, New Continuity Clinic, and he said the first few months he thought, well, I do have an unusual practice. But once he's started seeing these patients and connecting the dots, he's like, oh, now I get this. And then when he would do rotations at the hospital and he'd see somebody with cyclical vomiting syndrome or chronic abdominal pain, and then he'd take a history and like, sure enough, mom's got fibromyalgia. Sure enough, mom's kind of got an emotional hyperarousal or something, and starting to see this. And then it's like almost you start to see how these dots are connected. So I'm doing my part, and that's actually part of, I could do my practice in a small bubble, but trying to get that out there with the book and doing a presentation like this, and having that continued conversation.
Well, it really affects the quality of life overall. So if we can get people to have the tools earlier or know what's going on and explain why, even where we learned that later, much later in life, people get diagnosed with ADHD and they're like, oh my goodness, this explains a lot. So being like so dismissed and alienated potentially for such a long time. And that's why it's helpful to get the support tools as early as possible to people out there.
And I think one of the things too is that this can be a certain amount of pride thing within the medical community, because if they actually get this, then they go, oh my gosh, I've completely dismissed a generation of patients, 10, 20, 30 years that I've written them off. I've called them, maybe not to them, but in front of them, but behind their backs. Oh, she's coming in, smile, but on the surface. And that as a patient, they're just, I don't know what to do with you. Why did she come back to me? I really hope she goes to another doctor someday, and maybe you can find another doctor. I don't know what else to do for you.
Well, I think you could have a whole retreat. Maybe we could all just come to you and have a long discussion, because there's just so many questions too. I think we could bring you back in the conference for a whole other discussion.
Well, if anybody, if there's time that you want to ever do, and any kind of question and answer, I've thought of doing that, just even with the podcast. And maybe if people think that would be a nice thing to do a monthly interactive discussion, short presentation, or it could even be interaction about the podcast episodes and what the questions, thoughts on that. I love interacting with people and helping. So I don't know, is that something that, Danielle, you think that would be an interesting thing? That I don't know what format to do that under, if that's a Facebook or how to get connected with that. But
yeah, I think that's great. I think you have so many different topics on your podcast that would just be so interesting for people, and definitely to get the word out about those to help people would be great. So that's a great idea. I love it.
Yeah.
Any last questions, Danielle?
I have one question. So if you could pick one area of research with fibromyalgia, whether it's fibromyalgia and ADHD or like fibromyalgia and sleep, to have more research in, what area do you think?
Yeah, I think what's interesting is when you look at Bill Gates and Steve Jobs, they were these great innovators. Well, they actually took existing components and they just connected them, right? They didn't invent the screen and the mouse, they just used them. And I think a lot of it is maybe that increased awareness, probably doing a bigger study, like there was relatively small studies, and you go, well, why don't they have these big studies? I do lipidology. They'll do, 10,000 people in a study to show that there was a 5% greater survival rate on a cholesterol medicine. Well, it's more research dollars going towards that, but I think doing studies like that and getting them more studies out there. What we do know is that treating ADHD is the most effectively treated neuropsychiatric condition with the best, strongest impact compared to depression, compared to anxiety. So the research is strongly out there, and I only treat if somebody does have the co-occurrence of ADHD, not just fibro without ADHD. So I'm always making that stimulant use if they have the diagnosis of ADHD. If they don't, but as I think getting the strong impression is like, wow, there's a lot of people who are adults who've never been diagnosed. Women until 20 years ago were considered they even couldn't get it, and many thought that adults grow out of ADHD, and it turns out that really most people who are in the expert world of this is saying that no, people just mask it into adulthood, similar with the autism spectrum. So I think that connection are one area, like I say, being connected. I'm having a medical student, I'm like, just doing some case reports of patients like that, getting those out there. But potentially, trying to coordinate, I've never done a study before, but piggybacking on some of those, just making a bigger version of those. Problem is all the medications pretty much that we use for that are generic. So that's often driven from a medication standpoint. But is, like you said, getting support and understanding for these can make the roadblock for consistent exercise, consistent executive function, for meal planning, to prevent impulsive eating and prevent going on the treadmill when you're bored after a half hour, but actually have the attention span to actually, and persistence and motivation to continue to do those healthy life things. So it starts to spiral up. And that's why often when I take a history, most of my patients who have fibro, when they were younger, were usually very active in some way. And they're now extremely sedentary relative, and they often don't know they were self-medicating their ADHD, partly because they were super active and that's how they were treating it. They didn't know it until they break their ACL, or they just get out of college and they're not walking around campus and playing intramural sports, or they aren't not on the dance team, and they didn't realize they needed that. And then they get hit with a car accident or a flu or COVID, and now they're not so low. They're so low.
It's very interesting. We definitely will have to have more conversations. So
yeah, like I said, Danielle or Melissa or anybody wants to just email me, you can go to the website. It's at drmichaellenz@gmail. And even if you just want to say, I love the talk today, and great, and any other topic ideas or any other things, or maybe somebody comes up with a cool study idea, and it's like I said, I am connected with an academic center now. So that's not my assignment, is to be doing quote research, but I am rubbing elbows with people in that area, and that's always a potential possibility to be a lot more effort and work outside of patient care. But it's an intriguing part. I love learning about research and investigating these things and then applying it to patient care.
Well, we have heard from researchers that they want to connect with more clinicians. So this is coming straight from the NIH and research departments. So heads of research departments have told us that they want to connect with more clinicians. So you never know. We're building a strong community here of connection.
Yeah, I was on an airplane once with sat next to a guy who's doing an investigation of research at the local VA hospital, and talking to him, he's like, yeah, I think you're a researcher inside you. I think you need to be doing that sometime. So
it sounds like it. So for everyone out there, please do connect with Dr. Lenz. Go subscribe to the podcast, as you mentioned. If there's topics for the podcast that you would like to hear too, he's open to suggestions. And we do see him connect on Facebook. Go connect in the Fibro Connect group run by Lee. She does an amazing job, and we're all in there as well. And Dr. Lenz is asking questions. He answers questions. Some not medical, but he's asking questions on some of this information too. So thank you so much, Dr. Lenz, for joining us today. We appreciate your time.
Yeah, thank you very much for having me.
Well, we have Jill Economakos is backstage. I see her, and are you ready to give me a thumbs up backstage so we'll bring you on? Okay. Okay, so she is ready. So let me do the introduction here. My brain got moving with all of the questions for Dr. Lenz because I'm super fascinated with pediatrics. So let me get centered again. It's perfect that Jill is coming on to help us get centered. So I'm thrilled to welcome Jill to the stage, and I hope I don't butcher some of these certifications, but she is a Stop Pilates certified instructor, fascia release and movement instructor, a functional medicine health coach. Shout out to FMCA. She has an additional training for injury and special populations, pre-postnatal Pilates for golf and athletic conditioning, a whole background in fascia release, and then Halo certified. And there's a lot of certifications in there, Jill, as well. So we're going to pop you into the stage, and then I'm going to remove the background. Hello.
Good morning. Well, morning here.
Oh, it's definitely a morning here too. So it's still morning for all of us.
Oh, I'm so excited to be here with you guys today. We've been, chit-chatting online for a while, so it's nice to meet you.
Yes, definitely. Please let all our fibromyalgia friends out there know where you're streaming in from.
I am streaming in from Denver, Colorado, where the sun is shining. There's a strange light coming in, so excuse me for that.
Well, I know that some
That's great.
people, some of our fibromyalgia friends are now getting snow. So there's been snowfall on the other side of the country, except not where Danielle is at, and not where we're at. So we're a little bit warmer in temperatures for us. And those of you out there who are getting snow, please stay warm. Well, I'm excited to have you here. I know this is going to be something new and different to do a live demo for us to kind of talk about the fascia.
Yes. Yes.
And the science of a little bit of in-depth. And boy, do I need to do this morning because, well, I smell like eucalyptus rub and all kinds. I'm glad we're virtual, not in person. So I'll let you lead, Jill, and take it away.
Okay, well, let's chat a little bit about the fascia. I'm sure you two have read up quite a bit on it. For people that don't know about fascia, it's a connective tissue. It goes around every single muscle fiber, muscle bundle, tendon, ligament, nerve, organ. It is completely connected in our body. There isn't a place it breaks up, and it has more nerve endings than any other part in our body, 250 million. So it's our largest sensory organ. And, healthy fascia should move with us. If you look at it under a microscope, it's spacious and airy and well organized. Now, what happens through stress, trauma, injury, and what the studies have shown with people with fibromyalgia is that the fascia gets almost thick and dense. And it can create like a lesion or a knot. And when that happens, it restricts blood flow and oxygen. It restricts the mobility. Think of it almost as like a straitjacket. The muscle underneath it can no longer fully contract and release, so we even lose strength. And it can create a lot of pain. There tends to be a lot of hot spots and sensitivities. And people with fibromyalgia, where they tend to get some of these sensitivities, are big fascia spots, gathering spots. So often, as you're doing some of this fascia release, if it's incredibly painful where you're on, if you just kind of move off a little bit from that spot, you can target those areas, kind of working from around and in to help release it. The goal is to rehydrate it, to smooth it back out, and to create less pain for the fibro community.
Well, I do hear that it causes a great amount of pain. So, and it's everywhere around the body, correct?
That's right. That's right. So even your diaphragm. So here's an interesting, what do we do when we're in pain, right? We kind of huddle in, we tighten up, we want to like wrap ourselves around our body almost, which again is tightening your fascia. But you can meditate for hours a day, but if the fascia around your diaphragm is stuck, that diaphragm, so right when we inhale, our diaphragm should press downward, which allows our belly to expand. But then it also allows our lungs to be able to breathe and move three-dimensionally within our rib cage. That's what your breath should feel like. But if the fascia around our diaphragm is stuck and it can't travel down, where does our breath get redirected? Up here. Oh, my neck and shoulders are really tight. Oh, really? And that alone creates more stress. That produces more stress hormones in the body. So, even be able to just release the diaphragm and to be able to breathe, there's nothing more frustrating when this is stuck and you can't take a deep breath. And everyone keeps telling you, take some deep breaths, relax. It creates more anxiety, right? Like, I just can't get air. Well, that's why. So everyone just thinks the fascia work is around muscles, but even, through the diaphragm, through the organs is super important.
Well, and breath work is definitely important for all of us, and many of us, because we're holding, or we hold our shoulders. You'll see us hunched. I've heard your interview, which we're going to share out with everybody too, with Dr. Ron, where you're talking about the importance of posture and movement with
Yes.
that. Because right now, I'm feeling exactly everything that you're saying right now.
Yeah, and it's true. It is impossible to have good posture. It is impossible to have a strong core if you're not breathing correctly. So I'll have that. Even, people that come in with diastasis after pregnancy and their, abdominal split. Like, what can I do for my core? I'm doing, 5-minute planks and 100 crunches a day. I'm like, awesome. You are exasperating it. You're making, the breathing fully and deeply and connecting with the proper core muscles, the diaphragm pushing down into the transversus, that alone strengthens the core. So there's no way to have that good posture and that connection into your core if you're unable to take a full breath and if you're not breathing properly. Because like you said, you start come up here and then all of a sudden all the fascia in your chest gets really tight, right? And then our shoulders round forward. It pulls our head forward. And then our neck hurts, our shoulders hurt, in between our shoulder blades, right? All those spots that sound familiar.
Yeah, everything you're saying, I'm like, yes, I have problems with the breathing and everything in my neck. And
Yeah.
I've had a myofascial massage. It's the only type of massage I can get, because if I get like a deep tissue massage the next day, I'm like, no, too much pain.
Yeah, and that's what I love about this work is I will guide people through it, but it's empowering others to heal themselves and to controlling not only, okay, so let's say you're controlling the amount of pressure, whether you're using one of our soft balls, which a lot of people in the fibro community need to start with, just to get the initial superficial layers to release and hydrate before you're even able to go any deeper. But you're able to control the amount of pressure you want to give, exactly where you want to be with that pressure, and how long you want to stay there. That's one. And then another thing I like to point out to people, I know I've had this experience where, I might be stressed or upset about something and I go to get some body work and the vibe of either the person or just the space or sounds from outside, like I can't relax.
Yeah.
So the fact that you're able to do this in your own home, you can play your favorite music, get your favorite aromatherapy going, let everybody know, just give you that space. And you can do it at 5 a.m. if you're awake. You can do it before you go to bed. You don't have to schedule these appointments when, you look at your date book, that, okay, I can get in 2 weeks, sure. But you might not be having a good day that day. It might not be the best time for you to really be present with your breath and to be able to let go. So I just feel like it really helps speed up the process because you can do it whenever and however long you want as well.
Are there areas for fibromyalgia in particular? Because a lot of us, the mobility is quite a challenge. As you mentioned, there's pain elements too, especially when we breathe. So, when getting started with this type of modality, we're talking about the fascia. Where would you recommend we begin?
Well, I will first and foremost say the diaphragm for everybody. It's just has to be step one. And I often find like the chest and the pecs step 2. And I have 3 different ways to address the pecs, because if I give somebody with fibromyalgia or it's just super tender there, something that I might give someone that's more open, they're going to be really sore the next day. They're not going to want to do it again. So I, again, kind of have that soft approach. But the other interesting thing is, let's say even the softest of versions bother somebody with fibromyalgia that day on the chest. It's just that area. You can move to the back. You can move to the foot, because again, ultimately, the whole system is connected. So if I have somebody that has a headache, for example, I say, okay, we're going to start by rolling your feet. And they're like, no, my head. I'm like, yep, your feet, because you have a fascia line that goes from the bottom of the feet clear up to the back top of the head. And so when the feet are tight, it can tug on that whole chain. When someone has like low back pain or their hamstrings are really tight, I'll have them try to touch their toes, and, their back grabs, or, they can't get very far. And then we roll your feet, and all of a sudden they can go down 4 more inches. It increases the mobility that much. So I would say it's really individual, and the importance of playing around. And I have a lot of perfectionists I'll do this work with, and they're afraid they're not on the right spot. And I'm like, you can really roll anywhere that feels good to you. There's only a few things you can do wrong. 1, be on a place where it is too intense and you're holding your breath and bracing, rather than connecting with the tissue in your breath and getting it to relax. Sometimes people are like, no, I just want to get the most out of it. I'm going to go deeper. I'm like, you're actually defeating the purpose, because everything's bracing even more, right? That's like so 1980s. So like, no pain, no gain, right? No pain, all gain in my book. So you get to those areas and just try to soften and relax. So again, that's going to be different for everybody. The other thing is, as you're doing some of this work and you're rolling, some people, rather than kind of focusing on their breath and bringing their mind to the tissue, telling it to let go, like, okay, I got to roll this out, because then I got to answer some work emails, and then I got to make some lunch, and then I got to do this. And again, they're going so fast that their tissues never have a chance to release. So they're bracing again. So that's really the only thing you can do wrong. I always tell people, explore. The last little part is, if you have any impinged nerves, a lot of people with maybe sciatica, if you're on a spot where you feel a zing, you might be on that nerve and you don't want to be there. But if you just move an inch off of that, because that fascia around that area is going to be tight. If you move an inch off of it and get that nerve zing gone, start loosening up the fascia around there, it'll help release some of that as well. I hope that answered your question.
It does. And just unpacking, there was so much to what you said, and even these talking points. Let's just rewind a second. So, top of the head connected to the foot. So, if there's stuff going on like in the back of the head, I potentially should be addressing the bottom of my foot
You
instead.
Yeah. And it's not necessarily instead. You can still do some of the neck stuff.
Okay.
Or if that feels good, like even sometimes I have a headache and I'll just like dig this into my temple and it feels so great. But also if I'm on a phone call and if I roll my feet, that'll also help it. So, and it just depends. It's unique for everybody. So yeah, absolutely though. You can start with your feet if you feel a headache.
Well, and I know that this can be intimidating because we're talking about touch. For some people, it's like the hypersensitivity, allodynia. And this is going to be a theme for today too, with later, and how to experience this and gently like move into it and layer it. Moving, because I know conversations come up a lot about costochondritis. So what you said in here, a lot of us are diagnosed with that, all this tension and pulling in and pain. I think a lot of the fibromyalgia friends, and if you are one of them, you can feel it all in your face, your neck, your back.
Yeah. And so again, I was teaching a workshop in Houston not long ago, and I had a couple women with fibromyalgia in the group. And so, for example, when I had most of the group using this ball to kind of sink into to open the pec, that's too much, even though that's what's so nice about these balls. First of all, a tennis ball isn't designed to absorb our weight, right? It's not. And lacrosse balls and some of the other balls, they're like hard and they're plastic and they're just awful. I'm like, when I see people using those, I'm like, do you not love yourself? It just looks painful. So these have a little bit more of a give. So they're a little bit nicer and they have a grip, right? So a lot of the work I'll do too with fibromyalgia community is work on just hydrating the superficial tissue. So even just taking that ball and giving it like a twist on your skin, it gathers that tissue and hydrates it. And again, you can push deep and twist, or you can just go really light at first. So that grippy sensation is really beneficial for that work, which obviously a slick ball doesn't have, or like a fuzzy tennis ball doesn't have. So that there's purpose to that design. But the inflatable ball, the sphere, sometimes I'll just have, people with the fibro group, like I said, with that pec, just lean into that and focus on breathing because it's not a lot of pressure. Again, I don't blow this up until it's ready to pop. It has a little bit of give and you can play with it. And for my extra sensitive people, sometimes rather than lying on the ball, like even just holding it there and imagine filling the ball up with air as you inhale, is a nice introduction before, say, leaning into the wall with that and applying more pressure. So there's little baby steps that you can gradually do to build up to that work.
Well, and I know I see the questions coming in because there's a lot of like, how do we do this? Okay, so that's why we brought Jill on to do some of these live demos, but we definitely have to start with explaining more of the orbs. So we want to we'll be giving away these orbs too as part throughout the conference. I don't want to touch anything right now on my computer to set up the giveaway after. We're going to get through this interview first. But these orbs you have them for sale, and you also have classes too for more advanced instruction on what to do. But if someone wanted to get started, because we're going to be like talking about this a lot too, let's get started showing some people some spaces or demos. Should we go into the face? I don't know, Danielle, I am a mess this morning. So maybe Danielle will pick, because I always have a spot up here or in the back. So where should we begin, Jill?
Oh man. Okay. Yeah, let's get going. Okay. Well, since you mentioned the face and it doesn't require us moving, let's start with that. So grab your mini orb, the small one.
Okay.
And yeah, tension in the face, TMJ, clenching, grinding, all that stuff. This is a simple one you can do. And I'm sorry, the sun is just blinding. Okay. I'm trying to find the best way where it's not, but I don't have it today. Okay. So you're going to basically be taking this ball from your jaw, and you're going to be, again, with as much pressure as you want, plowing, grabbing, and sliding it up. Now, as you do that, we'll start here back at the hairline. You're going to pull your bottom jaw down in opposition. So I'm going to start to slide it up and then pull the bottom jaw down. And keep sliding that ball up. And we're going to do about 4 passes. So we're starting back here, and now we're going to come a little further forward towards the mouth, towards the jaw, and then slide and start to pull the bottom jaw down. Good. We'll do 2 more, coming a little further towards the mouth, little plow. Good. And do 1 more, a little closer to the mouth, plow it in and pull. Yeah. How'd that feel? The pressure okay for you?
Well, I like that we can control our own pressure.
Yeah. Yeah. And again, if you find that, on that 3rd spot right here, and then you could even just, spend a little extra time there. If you've ever had a myofascial massage or any massage, sometimes they scan over that part, like, no, but go back. No, but go back again and go back again. You get to do that, right? So let's try the other side too. Dig it in.
Now I have to get the thing is, you have to be coordinated a little bit.
And then pull the bottom jaw down. Yeah, that's it. Good. And again. Good. Dig it in and really pull that bottom jaw down as much as you can.
Oh, wow, that.
You found a spot. This too, I've had actor Dr. Ron, when he does this work, it always releases his sinuses. But now if you open your jaw, feel how it just kind of falls open a little easier.
Oh my God.
Yeah.
Yes.
My jaw was like hurting really bad the past 2 days. So
Ah,
that's crazy.
yeah, I mean, it's super simple and subtle. And sometimes like I always
Yeah.
do these check-ins with people because like, oh yeah, that felt nice. But then you do a check-in and you're like,
Yeah.
oh, whoa, that's a lot different. I have a glute release that I do with people that it's the same thing. It's like they do it and then like open their knee and their hip just has a huge amount of range of motion. But yeah, we can. Let's see. What do I want to do with you guys next?
Well,
Let's
and I wanted to say too that this is much better. I will say this is much better than rubbing a tennis ball up against your face.
Yeah.
So please
Yes.
don't do that if anyone's thinking, because
Yeah.
I've tried it before.
I used the racket balls, so that was worse.
Oh, yeah.
Yeah.
But yeah, do you notice this has like a little tiny bit of give and then it kind of comes
Yeah.
in and support. So it's safe in like all your bony landmarks and everything.
Yeah.
It feels much better. And then again, just to emphasize the difference, because some of us that have experienced the myofascial like massage, so it's really hard because I know you have to find the right person if you're going to do that. And I am particularly sensitive. So this is nice because you control the pressure and you can control it on yourself as opposed to someone else. Because for many of us, if they hit the wrong zone, because everybody always asks, please let me know if it hurts. But
Yeah.
unfortunately, once it hurts,
Yeah.
you're already in pain. So this is a good tool for us to be able to use at home in order to manage things at our own pace and our own strength.
That's exactly it. And, sometimes getting into some of these spots. So, some of my series, you're rolling like we did. Sometimes like, you're just letting the ball set, let's say in the glute, for example, and you can kind of squeeze the glute muscle for a minute so that you can let it really relax and sink. And there's so many layers of muscle there that if you just hold still and breathe, if you can just start to let it go and let it go a little more and let it go a little more. So just sitting there with it, you don't even have to move, and just getting those, again, to say, it's okay. You can let go. You're in a safe place. You're not in pain right now. And again, if that spot's too much, you just move it an inch and it might be the perfect place for you to be able to relax.
Yep, and you're not going. You can do it at home. You could be in your pajamas.
Yeah,
You can feel comfortable.
travel with them. So, all of my clients now, they're always in the suitcase. Some of them will use them on the airplane. I use the max at the QL, that kind of muscle between the pelvis and the rib cage. And you just can kind of roll it a little side to side, kind of tuck and tilt your pelvis a little, and it will release your back and that strain you might get in kind of the sacrum area when you're sitting for a long time. And nobody even knows, you're just sitting, rocking around a little bit.
Sitting like during a conference for too long where we need better chairs.
Yes, ladies. Well, and so if you're sitting too long, what do you think about rolling your feet? We've got some time, right? You want to roll your feet? You want to go through that series?
Yeah.
Okay. So I like to do the standing up because I like to apply more pressure. Again, you're on one foot, so you don't have to, but I also work with people with neuropathy and things like that, and they prefer sitting down. So that's okay too. You guys do whatever you want. I'm going to stand up so I can point the screen down so people can see what I'm doing with my feet. Does that sound good?
Yeah, that sounds good.
Okay.
And we'll definitely be including links to the orbs as well. So I'm just going to include a link to Jill's website where she has classes available. You do in-person classes too for anyone that is.
I do in-person and virtual classes and private sessions. And I'm also going to offer 2 specials for your community. So we can give that information out later too.
Wonderful.
And I was going to ask, like, for scar tissue, if you have like surgery in their scar tissue, like, how does it work with the fascia?
It's basically the same thing.
Oh.
Scar tissue is like a buildup of that. So
Okay.
it's the same thing. And I mean, it's one thing that tends to drive me crazy. So once the tissues heal, right? The scar tissue, the fascia, because it's really crazy. If you were to look at someone's forearm under a microscope, look at their fascia, again, it almost looks like a spider web. If you were to look at that fascia after being in a cast for 6 weeks, it's like a cement wall. So, and people go into strengthening it right away, right? Like once the tissue's healed, they go into strengthening it. Well, again, it's not going to have the full mobility. It's not going to have the full ability to contract and release. So it's not going to get the strength. It's not going to have the range of motion. So it has to be released first. That's what I do with all of my clients. And it's nice because, again, it gives them freedom and range of motion. There's nothing worse when you have that restriction. You're just playing tug of war with your body then, right? Yeah. Okay, so let's roll our feet.
Okay.
All right. So everyone gets this. Luckily, my feet are, I think they're clean today. All right. So again, you can do it standing or sitting, but I'm going to put it right in front of my heel a little bit. And I'm just going to push down again with as much pressure as you're comfortable with. Good. And then I'm going to slide it up a little bit mid-arch. And same thing, just pushing down with as much as you're comfortable with. Good. And then we're going to slide it up just a little bit more. And we're going to press down. Good. And then what we're going to do, so with we're going to go from the big toe to the heel and with consistent pressure. So again, only as much as you want, but keep it consistent. You're going to plow a line slowly towards your heel. I will say you can never go too slow. You can only go too fast. So there's that nice smooth pressure. You might feel some snap, crackle, pops. And then slowly back towards the big toe.
I feel the spot that's like exactly where.
And so if you get to one of those spots, again, where it feels tender, you can hang out there. You can even almost do like a little bit of a bounce like that.
Oh.
Yeah. That again, it's like pushing on a sponge. The more you never push on a sponge and then it can like absorb more fluid, right? So that's the other thing too. It's you can drink water, but if the fascia is not ready to absorb any of that liquid, it becomes basically like almost wastewater outside of our tissue. So if we can open those tissues up, it's going to allow for more hydration in. Now we're going to go from the middle toe to the heel. With as much pressure as you want, just keep it smooth. And slowly pressing down and back up. And we'll do that one more time. Good. And then last pass, I'm going to take it from my little toe to my heel. And same thing. Just nice, slow, smooth pressure. So again, you can sit, watch a movie.
Yeah.
And, you know, I have clients that I can't get to do anything else. They'll keep a ball under their desk at work and roll their feet out while they're at work. So that's always an option too.
And if you do stand, is it okay to hold on to something as well?
Absolutely. Yep. Now, if you're able to, just walk around a little bit and you'll see how different that foot feels to the other. Yeah, go ahead and take a little walkabout, Danielle.
We're a live broadcast, everybody. This is live demo, so we're doing this live, and I was trying it on the floor, and my orb ran away from me. So I can't move. So
That's fine. How
I'm
does that
reporting back.
feel?
It's great. It definitely feels different. Yeah. Which
Yeah.
is crazy because that's my bad leg. I did it on my bad leg. My right leg gets worse. So
Yeah.
definitely interesting.
Yeah, it almost like flattens out, right?
Yes. Yeah, that is exactly what it feels like.
You know, one example I like to give to people too, right? We have 3 hamstrings, right? The back of our leg. It connects near our sits bones, like attaches the tendons at the knee. I'll do a series where we kind of roll in between those 3 hamstrings. And what people discover is that, you know, when that fascia is loose, those hamstrings can move independently. And what tends to happen though, when the fascia gets tightened, it kind of bonds in and builds what I call one mega hamstring. And when that happens, it starts to tug on the low back. So if you see people that kind of like, you know, sit back here, that's generally what's going on. And they'll go to stretch their hamstring out and they keep tucking like that. So they're not even getting that separation of the hamstrings from the low back. So I'll do that with people and then they'll sit and feel the difference. And the one side just feels like totally flattened and almost like puffier. But again, then you're able to use those 3 hamstrings as they're designed to be used, which is kind of cool.
Yeah, that's this is like so amazing. I'm so excited to be doing this.
Good.
with doing this live, and this just all connects back to pain because people don't realize with all of it, as you mentioned, it's trying to hydrate this or pull it out because if we're all hunched over just naturally, because that's seems to be scientifically what many of us do when we're in chronic pain because we're trying to protect our system or just it's in here, so it causes so many problems, and just even how we might mitigate movement and aspects of that, like using the restroom, we might alter how we do things, how we walk. So it amplifies even more and creates a lot more pain. So it's really important that we release this.
Right. And, you know, here's something simple. So, you know, I talked about this in my talk with Dr. Ron too, but what does your dog or cat do when they get up from a nap? Right? They stretch. And what that's doing is it's resetting the fascia. My little boy does it too. He moves around a bit. I see him stretching. Now, that movement just resets the fascia line. When we're tight, so this is also similar to people that might have arthritis, is the shrink and the movement becomes here, right? And we want to be able to lengthen out beyond that, to stretch those lines out. And I know, Melissa, you had asked me a little bit about like stretching and things we can do when we're stretching. It's not a stagnant stretch that we need. It's just challenging and changing those fascia lines. So like even a baseball pitcher, right? Big range of motion here, right? But this is the only range of motion they're doing. So it builds up a fascia wall this way, right? So for them, you know, doing movements like this is going to help keep that fascia active and healthy. So one thing I tell people who are sitting like you guys are doing this weekend, if you're sitting in a chair, sorry, I need my camera crew. You know, just randomly doing things where, again, if you're in pain, we tend to not really want to. But if you're not pushing against resistance and you're just feeling a little more opposition, you know, just think of moving almost like you're doing a slow chair dance, you know, think of seaweed in the ocean. All of that stuff will be really, really helpful. More so than even just holding a stretch that might feel really uncomfortable, if that makes sense.
Yeah. So when
does.
you do the like if I were to watch TV and do it on my foot, like can I do it for 30 minutes or is that like my fascia's like no?
No, if it doesn't hurt, you know, if
Right.
something is super tender, you know, obviously that means it's an area we kind of need it, right?
Yeah.
but you don't want to go too big. Just be gentle with it. And the next day, you know, if it's not sore, then you can go deeper and longer. But if you're rolling your feet, you're like, wow, this just feels really good. You're not going to hurt your fascia at all. Right. So
Okay.
yeah, go for it. If it feels good. That's the thing. It's funny. When I start working with people, I'm like, okay, just try to commit to like doing at least just, you know, even if it's just 5 or 10 minutes of one rollout a day. But they're like, oh my God, I did it 5 times, the full body in one day. It felt so good. I'm like, okay, well, if it feels good. And
Yeah.
I will say the other thing about this. So, you know, you noticed, Danielle, like when you walked up, or both of you, when you did the jaw and it released, you will have that like instant improvement in mobility and relief, but the work is really accumulative. So I had been a professional dancer, and when I retired, it was like I couldn't stretch enough. You know, it was just like no matter what I did, I'd spend an hour stretching, I'd still feel tight. Well, of course, because the fascia around it was tight, so it would just pull it all back, right? When I started rolling, it was like, oh, okay, I didn't feel that need to stretch as much. But if I were to start, like, think about where I was day one of my fascia rolling, and fast forward a year later, I felt like I had a completely different body. Like my breath, my posture, just my ability to move. And you know, you can see it when you see people walking. You know, like some people move and they seem pretty free in their bodies, and some people, you see them walk and it's like they've never moved from this position at all. And this work is accumulative. So if you start rolling and do a little bit every day, I promise you within a year, again, you'll feel differences right away, but in a year, you're going to be like, wow, my body just feels more free, is generally the feedback I get from people. I felt locked in my body. Now I feel free, which is pretty cool.
Okay, so we can start with go slow, build up, but it's going to vary from each person.
Yeah. There's not a right or wrong way to do it. Do what feels good. The goal is, again, to empower you to heal yourself. And nobody knows your body and your pain and your current energy that day better than you, right? So if you can commit, you know, again, just a small amount of time at first. I'm going to dedicate 5 minutes in the morning and 5 minutes before I go to bed to just rolling something out. Generally, people will end up going a lot more than that. But if you can just commit to that little bit, you don't have to fold yourself in a weird position. The work isn't exhausting. You won't, you know, wear yourself out. So it's something that's generally pretty easy and people look forward to committing to.
Well,
Yeah, I
I'm
love that
going to have
you just sit
everybody
here
hold
and
me
do it.
accountable. I know. I think Danielle and I will hold each other accountable.
Yeah.
Yeah, it's always good to have
Sometimes-
an accountability buddy.
Yeah. I'm gonna text and be like, did you do your fascia release today?
I just have to make sure my dog doesn't steal the orbs. He is obsessed
Yes,
with
no, it's so true. Now all my clients, it's really funny you say that. They have like sets now in their purse, on their nightstand, and at work, because dogs, kids all find them fun to play with.
Well, and Marco is here. I wanted to just say, I guess he says he gives, well, this is a fun way to do stretches, is he gives funny names to these stretches. So the Tonka, the hula, have you ever given funny names? This might be a creative way to get people to move more. I love it.
Oh, that's so funny. I'm like, I don't know if I should share the name that so many of my clients have given to the one where you lie on your bed. So again, my favorite one, I'm going to show this really quick. If anybody ends up getting a gorgeous ball, one of the best ways to start being able to release your diaphragm is to place the ball. So right here's the bottom of my ribs, kind of goes under there. Place the ball there and just breathe into the ball. And every time you exhale, you're trying to relax your back ribs and relax your shoulder blades. What many of my clients have called that one is the barfing frog. I don't recommend doing it after you've eaten. And it is incredibly uncomfortable the first couple of times you do it if your diaphragm is stuck. But before long, you'll actually crave it. When you feel your breath going into those areas you know it's not supposed to be, you're going to actually crave that. But since I showed that one, and since I said releasing the diaphragm is so important, I do want to give you the step one if that one's too intense, which is all you have to do is lie with the ball on your diaphragm here, and you let your arms, I just interlace my fingers, I let my arms be dead weight. And as I inhale, rather than letting the ball rise up with my breath, I let my arms stay heavy into it. So as I inhale, my belly has to kind of press into it. I hold that inhale for a moment. And then as I exhale, I let the ball help the diaphragm fall and sink a little bit deeper. So that is a good initiation into the barfing frog. But I think of a more fun name that makes people want to try it.
I think that is a fun name right there. So I think you might have to brainstorm more with Marco.
Yeah, Marco, thank you for that.
I know Francis was wondering about exercise for upper and mid back, but are there different ones? Are they the same? Can you hit both? Like all?
There's a whole bunch, but there's a whole bunch for the upper, a bunch of different funky ones. But I'm going to show you the one for the mid back because again, if you've been in pain and you're here, it's like you build this hard tortoise shell right in the middle of the back. And for me, so I was born really lordotic, meaning that my lower back had a really big curve like that, which created all sorts of problems. But when that happens, what your body does to counterbalance that is this, right? And I was asthmatic as a kid. So the role that I had to do every day that changed my posture and my breathing is the one I'm about to show you for the mid back, that and the barfing frog. So what you would do is you would take the 2 mini orbs and they come in that net bag, right? So you put them in there, you tighten the bag up. And again, there's not a right or wrong place. You can go and do this completely down your spine. But for what we're talking about today, I'm going to start with them kind of up near like the top of my shoulder blade. So not in my neck, but up through here. And what you do is you can place those balls down. And if lying on the floor is uncomfortable for you or it's too much pressure, you can also do this against the wall. But you place yourself on those balls and you just move your arms around a little bit. So you can open, you can give yourself a hug, see how that feels. I like to do these little kind of scrubs up and down. You can also kind of roll side to side. You can also go-go dance. There you go, Marco. That's a good one. Go-go dance. Go-go dance. And then what you would do is you lift your head up a little, use your feet, and just push so the balls go down one joint, and you lower back down. And again, moving your arms around in any of those patterns. But you basically move joint by joint by joint down the spine. So it gets right in there. Where a foam roller is a little more broad, this is really getting around each of those joints in your spine. So all the way down the thoracic, moving. There's no right or wrong way to move your arms. Do what feels good. If you have a tight lower back, you can do that too. Obviously, you don't need to move the arms around anymore. What feels good once you get into like the bottom of the ribs or the lower back is just kind of tucking and tilting. I'm exaggerating so you can really see what I'm doing, but tucking and tilting your pelvis a little and just kind of rocking it a little that way. That'll help that part of the spine. But that for me, that was my everydayer. And I will say, like when I first started it, it was like I was lying on like rocks in certain places. It was so tight for me. Now, when I go to lie on these balls, it's like I don't even realize they're there. I barely feel them. So if it is tense, I do promise you it will relax. But again, if you do it against the wall with your knees bent, you can lean back a lot. You can lean back a little. You can do those little scrubs. You can kind of squeeze the shoulders together and that'll target it as well.
Well, we appreciate all this information. Danielle, do you have any additional questions before I go to my other one that Jill knows that I'm going to ask her about?
I have it up against my low back. I'm like doing the sitting in the chair right now, and it feels great. So
Good.
Oh, good. I'm glad. Danielle's been tremendous in doing all this. So any way we can support her right now to get some relief, go at it. This is us doing it live. Well, Jill, one of the questions, because of your background with Pilates, and there is a lot of fibromyalgia research that says there's benefit to it, but it's so challenging. It looks really intimidating because all of the images I see online, I'm like, I'm going to fall, or I don't know. It sounds really intimidating. So when these studies come out that fibromyalgia, people can get a lot of benefit. What do we do? Like, where do we start with some of us that are a little bit more clumsy and scared?
It's so funny. Everyone that always comes into Pilates are like, I have to be your worst student ever. I'm like, every single person says that because it's like learning a new language. You're not working your big primary muscle movers. You're working those small, subtle stabilizers. You can't power your way through. I have this one, and I'm sorry for all the men listening in, but I have this one simple little exercise that I do with all my men that the minute they come in to say, just to show like, leave your humility at the door. You're not going to power muscle your way through it. It is the subtlety and softness. So, and also I will say to you personally, Melissa, people are putting on pictures of them doing the crazy stuff. There is a lot of very simple movements, closed chain movements where you're in a safe place. I also want to really recommend looking for a well-trained instructor. Unfortunately, like all things, there's a lot of studios doing weekend certifications now and things like that. And, all that, like, this is like Pilates on steroids. You don't want that. That's not Pilates. Okay. So the goal of Pilates is, you're moving slow and you're moving with a light spring to challenge your deep stabilizing muscles and connecting with your breath. So you're not pumping and shortening muscles. You can add that athletic element in, but especially for someone that came into my studio and says, I have fibromyalgia, I'm like, okay, we're not going to do the athletic conditioning, right? So moving soft, moving slow with really light spring load. I do that a lot with people. I'll drop the intensity down and it's way more challenging because it's working your stabilizers. So I think that's one of the reasons Pilates would be really great for people in the fibro community, and also even using things like bands so that, again, you're not pumping iron, you're pressing into the band, and then you're trying to go a little further, and you're trying to go out a little further, and you're getting that length again, right? You're elongating the muscle. That's what Pilates does. It lengthens the muscle through the strength. It's not shortening and tightening and contracting more. So it is 100%, I think, a wonderful form of exercise for the fibro community.
Well, and that's why we try to distinguish and educate, because we see the research, or we hear from doctors to do certain things. And I know that we need to move our bodies, but we want to prevent injury and then also prevent high amounts of pain if we can. I know sometimes it's hard when we start moving. We might feel a little bit of it, but trying to distinguish between Pilates, and even when people talk about yoga, we've heard some people jump into straight like the hot yoga, and then we all pass out because half of us have POTS, so we shouldn't be in that.
Yeah.
So it's trying to find the middle ground.
Up and down, going up and down too, right? I would 100% highly recommend a few things. I mean, doing your research on the instructor certification, interviewing the instructor, observing a class, asking them specifically how would they work with somebody with fibro, see if they know their stuff, see if that resonates with you, observing, and even saying, I just want to try out, can I just come in for 30 minutes of the class? And just seeing how that feels to you, and not to be afraid. I have a couple of clients with POTS from long COVID, and it's like, okay, we do an exercise with lighter spring, we move a little slow, and then we relax for a minute. Okay, you feeling good? All right, let's move on to the next. Right? Sometimes, unfortunately, with a lot of trainers can be like, oh, I'm going to give you the hardest workout. And, if you ask my clients, they're going to tell you I'm the hardest instructor they have. And it's not because I'm pumping them up with a ton of springs and making the exercise it's hard. It's because I insist on perfect form, the quality of movement. And that is really challenging. But the beauty and I think one of the most wonderful gifts of Pilates is it teaches you how to move your body efficiently and effectively, where you should always walk out of here feeling longer and more energized and more centered. If you're feeling, and this is even just for my regular population, if you're walking out of here exhausted and you want to take a nap, then I didn't do you justice, because it's all about having functional strength to move. I'm like, okay, I'll ask, are you going out for a pro football team? Are you training for the Olympics? No? Okay. Well, then let's talk about how we keep you moving with agility and grace and stability and mobility and confidence. And that's really what any good workout should do. So really talk to your trainers before you jump into a class.
I think that's a really great point, and just important with emphasizing what type of movement they're trying to accomplish. Because some of us are not trying to run marathons or be athletes. We just want to lift up a laundry basket and be able to do laundry without feeling like our arms are going to fall off.
Yeah.
So it's every day improving quality of life. And how do we do that with movement? And that's why we appreciate what you have to share.
Yeah. And I would say too, always start with, like, if you're doing some even arm work at home, don't have any weights. Don't use any 2 or 3 pound weights. Don't put anything. Just, if I have a client do this for 30 seconds, but really feel the shoulder, feel the back, guess what? You're engaging those muscles. They're working, right? That's all you need. And like you said, to be able to lift that laundry basket, we don't have to create more friction in the body. So always start super light. Always, always, always.
Yeah, or Marco said even making the bed. So stuff like movements like that for daily routines can be challenging, but we know that we have to move. And again, we try to create these adaptations, but we might be putting us into service by our posture.
Yes, yes. Oh, yes. It's so it's so true. So, for example, let's say somebody comes in with rounded shoulders.
Which
And
would be me. I'll be your perfect guinea pig.
right? And then you're like going to do some rows and you're doing this, right? You're pulling this way. Well, you're just making that worse. So it's like, first I try to get everyone, here's a good little thing to get your shoulder blades, right? Because most people are winging in their back. If you place your hands right on top of your head and lift your shoulders up into your ears, and then let your shoulders go back, and then imagine your shoulder blades melting down the back of your rib cage. Now keep the shoulder blades exactly where they are. Open your arms out to the side and then let them float down again. Try not to let the shoulder blades move. That'll generally get them nice and flat on the back of the rib cage, right? I'm not winging. Now, when I work with somebody, let's say I have them do a row, we only go to the place they can maintain that. If you're going to the place you're here, well, ouch, ouch, ouch. And again, it's not functional, right? We need to be able to get our body strong in neutral alignment first. But I will also say you can't just strengthen the back muscles to get your shoulders open. You have to first release the fascia and then strengthen. Otherwise, again, it's tug of war, and that's exhausting, especially with somebody with fibro. So roll, 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 roll.
Ah, that's a big connection right there for anyone that's just jumped into like strength training without looking at all this aspect if you're in pain.
Yeah, absolutely. Absolutely. And again, like we talked about earlier, if you're rolling and releasing, your body's setting in neutral, but now also your muscles can move in that full contraction and release. So it's going to feel stronger. You're setting yourself up better. If you're so tight and they're just going like this, imagine how exhausting that gets really quick. It's like all of a sudden, right? If you're looking at this, and I talked about how when you inhale, that's how your lungs should feel, right? Now, if you're breathing like that, you're getting how many breaths a minute, right? But now let's say you're breathing like this. just one little part. And it's like the whole system's like, oh my gosh, I'm exhausted, right? So yeah, super important.
Well, you have been a wealth of knowledge. Just a shout out to Dr. Ron and the team at Texas Center for Lifestyle Medicine for connecting us together. I missed the opportunity of seeing you in person, but we definitely have to make it happen in 2024 to take a class. Maybe we can help you set up a Fibro tour workshop over there in Colorado.
That would be fun. Yeah, we should set that up. I love empowering people to feel better. When I can see someone's meter and their quality of life move, the sparkle in their eye, it just fills my heart. I love being able to help people with that.
Well, you've definitely empowered me with these orbs. I'm definitely using them. So
wonderful. Well, and I'll share with you. I'll email you maybe the couple specials that I'm going to offer your Fibro community if they want to take advantage of any of that as well.
Yeah,
I know that people would love that because this information is stuff that you can invest in. You can do it at home, which is important. We're empowering people because sometimes mobility or even transportation becomes an issue, especially in remote areas. We do tap into that system. So leaving us today with all our fibromyalgia friends, what's ahead for 2024 for you?
Great.
I know. Can you believe it's 2024?
I know. I'm hosting a retreat in Costa Rica in March. So I'm like, my mind come January is turning a little bit towards getting that set up. But, just bringing this fascia work to more places, offering more workshops, connecting with more communities, because I mean, there's so many people that need this help. And again, just making it accessible. So I'm going to, like you said, kind of look out, be on the road, try to come wherever people are willing to invite me in and helping them out.
Well, you have a team here because I know people were asking about online lessons too. So for everybody out there, even if we do a Fibro Tour event, we're going to push technology not only to be in person and online at the same time. We're notorious for creating trouble with that. Dr. Ron has tried to tell me to not do that much, but pre-recorded stuff, but we always push the content live. So thank you so much, Jill, for being here. We are going to do giveaways of more of the orbs through the conference. I know Cassandra is out there too, and she's posting on YouTube. Cassandra, my friend, you need to send me your mailing address so we can get you. She was the winner on Monday of the orbs. So we will be giving out more of those too. But we appreciate your time. Thank you so much for being here.
Wonderful.
We're definitely gonna share your info.
Great. We'll chat more soon. And thanks again to everybody who jumped on.
Thank you.
All right. Bye, ladies.
Bye.
Okay. We made it. We're going to be doing giveaways too later on today. I promise I will get it up. I'm just trying not to touch the system right now too much and do too many things for all of this. So keep typing in #FibroNerds. We have had an impressive morning. We loved it. There's a lot of conversation here from Dr. Lenz and Jill. So a lot of demos. You will be able to watch this content in replay form. And then once we are complete with the Fibromyalgia Community Conference, we will be breaking down content individually too to make it helpful, because I know that we are going for long days without stopping in one feed. Yes, Cassandra, that is you. So I need your information because on Monday for the Giving Tuesday event that we did, you won a set of the Orbs bundles from Jill. So we want to get that to you and mail it to you. It gets sent by Amazon and you'll get the bundle. So you'll get the mini orbs, the other orbs. I should have asked her just to break down what they're called again. Yes.
The big one.
What Jill just demoed, you'll get it. Yes. I'm so glad. So we want to send more. I don't know about international. Again, I forgot to ask that question, but we'll figure out and maybe a compliment to it and bring Jill back as well at some point. We are going to take a legitimate 10-minute break this time. So come on back in and then we will get everything set up, because up for the later half of the day is Elaine Merryfield's presentation. She's going to take us through a nature walk we're going to have the team from the specific chiropractor centers from San Diego. They're going to be joining us. And then we'll also be here with Kelli. Kelli is the founder and president of More Than Lupus, and I'm excited to bring her on. We do a lot of work together. She's had me as presentations. I love everything that she does for More Than Lupus. So she will be there later today for this first half. Because Danielle, we have a whole evening
I
planned too.
know. With Taiwan, Carrie's coming on.
I know. Danielle's going to put up with me for a long time today. I'm glad that she has
Not
the
just
orbs.
today. So.
Oh, yeah. Danielle is hanging in there with us. Yes. So later tonight, we will be a whole Saturday night live tonight. And I think I have to get the timings right. So it's 9 p.m. Eastern, 6 p.m. Pacific time. For those of you tuning in, we're going to have a fun session with Carrie from Taiwan and the team over there and everybody streaming in. We never know of the surprise guests that might show up as well. And especially, you never know who's going to pop in from Pause for Fibro if they like me. Toby this morning did not want to jump in. He was very annoyed that I woke him up too early. So I definitely would need to coax him, but we may have some other members. So we are going to then take a quick pause here, and I'm going to put the break, I think 10 minutes, right? So we'll see everyone shortly.
See you soon.
Hello, fibromyalgia friends. Come on back in. We're going to get the program as resumed again. We appreciate you allowing us to take a little bit of a break. Last year, I know we learned the hard way when everybody said, I think we streamed for some of the streams said 8 hours straight, and I don't think we factored in break time. So we appreciate you taking this time to take a break, and we will be back to you with a break shortly. So I think my body wanted a little bit more of a break. And StreamYard is acting a little bit like my body right now. So impressive reach. I think there's just a lot going on when I do too much behind the scenes. Yes, great news. Okay, Cassandra, we will get you those orbs. And I know people are asking questions on where we can get that information. So we will definitely put the links in the chat for you after this. So I'm going to try not to do too much right now so that we can get started with Elaine's presentation and get everybody set and hopefully with whatever is happening too. Let's keep sending good vibes that the internet keeps me going. Oh, there we go. So Danielle put it in the chat too for reaching out to Jill, and she does a lot of online work as well and has online classes. So please connect with her, follow on social media. We will include all the links in the description of these videos too, so that you can connect with everyone and all the speakers whenever you can. So come on in. We're going to resume this presentation, and I'm excited to continue the next half of the event here. Actually, this could be considered the third, or there's 3 parts. So we'll get this with Elaine. I'm thrilled to be able to share Elaine's presentation with you. Elaine is an educator, author, and healing guide who is navigating life with fibromyalgia. She has a personal fibromyalgia healing journey that began 30 years ago. When she was diagnosed, there was minimal information available and, of course, no improved medications. She was single, a registered nurse, and had limited financial reserves. She researched and connected to find as much fibromyalgia information as possible and has become a resource and a dedicated educator in the fibromyalgia community. Her journey has repeatedly returned her to these wonderful lifestyle choices and fostering a mindset that supports healing and wellness. She is giving away her free ebook on Amazon, and we will post the link during her presentation. She is being interviewed in this presentation by Brandy. Shout out to Brandy. I know Brandy could not make it through this conference. She is currently with her father in the hospital. We miss her. We appreciate her. So she is doing and conducting this interview with Elaine, and I know we can have a lot of time to connect with Elaine. Elaine is offering this free download of her ebook over there on Amazon. It's already started, so go definitely download the free download, get your copy. It's a wonderful book. She has wonderful resources as well with groups. So I'm going to welcome Elaine's presentation to the stage. And actually, I need to re-upload them. Okay, so let's get her back here, and I'm going to start the presentation. And we're so delighted to have you here at the Fibromyalgia Community Conference, and I'm excited to learn about our connection to nature more in this interview.
Oh, thanks. It's wonderful to be back again, Melissa.
Well, fabulous. I know that you're prepared a fantastic presentation with Brandy. So I'm going to go backstage and help with production, and I'll let Brandy take it away.
Hi, Elaine. Welcome.
Hi.
I'm so excited to be able to have this conversation with you and share with the community a little bit more about your creative expression. So let's ask you first, what led you to creative expression?
Yeah, and seeing it as part of healthcare because my background is in nursing originally. I left nursing about 4 or 5 years after I was diagnosed with fibromyalgia because I didn't have the capacity to do the job anymore. But, creativity has always been an interest of mine. When I look back, it's always been an interest of mine. And I've read many books about it. I've followed various artists and whatever. And since my 20s, I've always had 2 or 3 friends in my life that were actively creating. They either were potters or musicians or writers or painters, but I never saw myself as particularly creative. And that's been part of my journey through taking care of myself with fibromyalgia. And it's not something I ever intended to do, but it just kind of evolved through this journey with fibromyalgia. And I'll add one more aspect to that too that really drew me into creativity. After I left nursing, I didn't have a backup income. I was single and I was just, at a quandary what I was going to do next. I did have an opportunity to help an elderly couple a couple mornings a week, but I thought, what else am I going to do to bring in some income? And I love children. I really love children. I didn't have children of my own, love children. So I thought, well, I'm a nurse, if I run an ad that, to do private childcare, I'll probably get some takers. And I did. I got a big response. And I chose this family that the 2 little boys, one was 6 months old when I started, and the other had just had his 3rd birthday. I was with that family for years and years, with the boys when they went through school. And then, it ran into helping the mother with household tasks, and she had her own business that she had an office in the basement. So I do office tasks for her too. So I stayed in connection with that family, and I would go 3 full days a week, and they were staggered, so they weren't back to back. And those little boys, I mean, I've told them this repeatedly, and I think the older one finally gets that because they're in their early 30s now. They were a big part of my healing because I got to experience on a regular basis because I was really invested in them, and they were so loving and so sweet. And play is what kids do. That's how they learn and explore. And so I got to view life because I was headed into depression. By the time I left nursing, I could see I was having signs I was heading into depression because my life was getting smaller and smaller. I was changing jobs, doing part-time jobs in nursing, trying to still hang on to that nursing role, and it just wasn't possible anymore. So when I started working with these children and seeing them on a regular basis, and they were such sweethearts that I started to see life through their eyes, and they opened me up to seeing wonder again in life. And our play projects, and their mom wanted them out for a walk every day, so that kept me walking. And yeah, a lot of this of really reconnecting with the wonder and the mystery in life and seeing life through this creative lens was through those little boys.
And what better, yes, absolutely. And what better way to be able to really enhance that creative expression through play, like you said, and children really do bring that play to the forefront and, make life just a little bit easier. So how has that creative expression help you manage and cope, such a difficult condition such as fibro?
Yeah, and it's evolved very slowly because I will speak to some of this, why my creativity was so blocked. I'll speak to some of this when we share some images in a bit, and I share one of the writings associated with one of the images about my background and why I was so blocked in my creative expression. But it really helped. It really helped expand my mindset. And because when you're in that creative place and in creative play, then you're using another part of your brain. You can't be in that, that really fearful place and be in a creative place at the same time. So it just expanded my life. It started to expand my life because my life had become very small. And it just happened incrementally. I've always had this interest in photography since I was 12 years old and was given my first little box camera at that time. So, the ways in which I've expanded that and then incorporated writing with that, it all started with seeing the world through my camera. And yeah, that's about all I can say right now. I think more will come out as we share the images, but it expanded my mindset to start to see new possibilities in life. And I don't know if that makes sense, but it's in the fact of just expressing more of all of who I was. I wasn't just about fibromyalgia. There was much more in my being that wanted to be expressed. And it reconnected me with play, and also reconnected me with finding meaning in different ways in my life.
I love that. Thank you for sharing that. It's very beautiful. And I love how you put the positive on there and bring that creative expression to the forefront. So you do have some images to share with us. So and that way you can, be able to walk us through this creative expression. I'm going to go ahead.
Yeah, just give us some examples so you can see what I'm talking about a little bit. And this has evolved. I've done various things. What I strongly believe in, and one of my, forefront and how I express myself creatively, is I really believe in the power of words and images. They both have incredible power. And that's why images are used so much in advertising, and because both of them evoke emotions. And when I'm in my creative play mode and when I'm encouraging others with that, is pay attention to words and images that give you, a certain sense in your heart, something that inspires you or opens you up to seeing in a new way, or makes you see wonder in life again, or just lights you up. Then you're tapping into life-giving energy. And that's how I see creativity. It's life-giving energy. You're tapping into, the life that we're all part of, that bigger picture.
Elaine, we are kindred spirits. I am a visual person. I cannot really understand something until I see it visually, and images and everything visual just really draws me in, and it draws on my emotion. So I am connecting with everything that you're saying right now. And I am very excited about you sharing this with our community and being able to see that in action.
I love it. Kindred spirits. I'm looking for more of them.
Yes, we are here.
Okay, so we're going to go ahead and look at some images now. Okay, this is I just picked out several. I've just had a deepening connection with nature. Really, it's been there throughout my life, but at different points I just really didn't pay attention to it. But really a deepening connection with nature since the beginning of the pandemic, let's say. And yeah, I took some classes then around the medicine wheel in different cultures, and just really honoring nature and understanding. I wanted to strengthen my own relationship and understanding that I'm part of nature, that my body's part of nature. So this is what's come out of it in the last couple of years. This is an image I took in 2022. It's called Stripped Bare, and it's these wonderful old oak trees, and they're on the grounds of an abbey where I was living, and I lived near there. I just moved back into the city this year, but for 12 years I was living out in that area and visited that abbey periodically, and there was such a sense of stillness and peace there. So this is what came forth from this picture. And see, I take these images, I take lots of photographs, and then when I look through them later, there's certain ones that call to me, and there's some kind of conversation. I'm calling them at this point, my working title for this collection is Nature Conversations or Nature Visits. And this is what came out of this image. Here we are in our nakedness. I see your vulnerability. I sense mine as well. I see your weathered outer shell. I sense mine as well. I see signs of your inner endurance. I sense mine as well. I see the markings of your capacity to tame challenges encountered along this life journey. I see mine as well. I see the grace of your presence within community, because there's all these trees. Oh my God. My heart is full of gratitude for your steadfast companionship. Together, we witness moments of both mystery and discovery as part of life's endless unfolding. I draw upon your strength. I am discovering that the life journey may include both, quote, this and that, end quote, together. In other words, it can be both daunting and a blessing simultaneously. I feel like nature is just teaching me so much, my contact with nature these days. This photo was taken last fall a year ago, and it's in a rhododendron garden. I moved back into the city, and I'm near a rhododendron garden that I purchased a annual pass, and then I can go for free whenever I want, and it just feeds me a lot. Well, this one, Reflections on a Fall Day. The energy of this fall season prompts my mind and body to slow my daily pace. The outer world busyness of attending to my projects of spring and summer are moving into memory. More often, it is nostalgic reminders of past fall seasons that come to visit me now. I often, this as an aside, I often go through this little melancholy phase as we start to switch, as I start to see the angle of the light change in the sky and whatever, and the leaves start to change colors. I always get this little state of melancholy for a while because I don't want to leave summer. And then once I move into that new rhythm, then I just really appreciate it. Back to what I wrote. My physical senses are activated by the scent and sound of fallen leaves crunching under my feet, the rich palette of autumn's colors, the feel of cooler temperatures on my skin, the decreasing hours of daylight, and the changing angle of the sun. There is a sense of settling into a slower rhythm during the season that I welcome. It is a rhythmic change felt within my body that helps me recognize my connection with all of the natural world around me. All I need to do now is to allow. I find this can be challenging for us humans. This photo was taken in June this year. There's a canyon that's about 125 miles from me here in Portland. That's kind of remote. I've been there 3 times. Friend met me there this year. I'm not sure whether we'll be going again or not. I am 78 years old. I had my 78th birthday in August. So we're questioning whether it's the wisest thing to be in this area for, several days at a time. There's no phone service there, but it's so gorgeous. And when I first went there in the fall of 2019, it's in Oregon. I'd gone over to the eastern side of Oregon and was on our way back. My friend and I stopped there for a night, and they have 4 cabins they rent out there. And then there's a small campground. And she had wanted to go there for a couple of years prior to that, but it's rattlesnake country. I said to her. So anyway, I agreed to do it for one night on the way back on this trip, and I fell in love with it there. I felt like I was home. That's all I can say. It was strange because it's landscape that's totally unknown to me in this life. I grew up in New England. Now I live in the, northwest corner of Oregon where it's green and rainy. And here it's sagebrush, it's dry. You're in this canyon that the John Day River runs through, this big river. And how I connected with it, what it gave to me was this sense of being held on all, you're just surrounded on all sides by these high canyon walls. They just surround you. And I had the sensation the first morning after I arrived there, and I was up early in the morning, sitting on the porch of the cabin, looking around as the sun was coming up, and I felt like I was being held. And also I had a sensation like I was in the womb. It felt so safe there to me. So I love returning there. But this particular picture was taken this year when I was there. And the sky was big and blue and beautiful this year when I was there. And this is what came through to me. I stand here between earth and sky and gently lean into a deep inner knowing. I am an inseparable part of this vast and wondrous web of life, and I never need doubt that I belong. So it gives me a sense of safety there and a deep sense of belonging that I'm trying to nurture. This one will give you a little bit of background of some of my history and what I consider some, wounding to my spirit when I was a child growing up, not from ill-intentioned people, but people who had their own wounds. And so, some of that generational trauma that can be passed down in some of the messaging that goes on in families sometimes. I call this one Sensitivity and Inner Strength, and I was pet sitting for a family, and they had these beautiful pink camellias blooming, and I brought one in and put it on the windowsill, and I just loved seeing the fragility and what felt like vulnerability in this blossom, and this is what came through. Sensitivity and inner strength. As a child, I was often told I was too sensitive, and also to be more sensible about my aspirations in life. As an adult, I came to realize I had simply been taught to view the outside world as my authority. I have found that this is not terribly uncommon. Fortunately, from an early age, I had a sense within myself that there's more than this, and I know there's another way. I can remember having that realization when I was about age 12. And I used to say to myself, I grew up in Vermont, and I used to say to myself when I was kind of at odds with my family, when I grow up, I know there's more, and I'm going to Boston, which seemed like the whole world, to me. I never did go and live in Boston, but anyhow, back to what I wrote. I am so grateful for this strong inner prompting to believe in life possibilities and to pursue my own form of expression. And that's what I'm talking about, creative expression here. My inner guidance system has felt battered many times in the outside world, and yet it perseveres and sustains me whenever I listen to it. I especially lean into it during big life challenges. I honor it more and more as the years advance. It always guides me toward a deepening trust in life and in myself. I wish the same for others I meet along the way. So that little image there just gives a little condensed version of what I feel I experienced as emotional wounding or wounding to my spirit when I was young growing up. And I received messages inside and outside of the family because I was a very sensitive child. I'm still a very sensitive being, as I think many of us are. And so anyway, that just kind of encapsulates it for you. So I feel like a big part of my journey with fibromyalgia has been the healing of that wound and stepping into my sovereignty, that it's an ongoing process of stepping back from allowing the outside world, to be what is my authority, and realizing that I have, power within myself as just being a part of the natural world and part of this whole, creative process of life, that I have my own seat of power within myself. And the journey is learning to trust that more and more, and to return to the messages that has for me more and more on a regular basis. The next one is called Dancing Tree, and this was taken in the fall a couple of years ago, 2022. And I love it. I was at that same grounds where the Abbey is, that where I took the pictures of those bare trees at the center. And this tree, this particular day, it just looked like it was moving, and it just looked like it was in dance. So I called it the Dancing Tree. You bring an easy smile to my face, dear tree that dances. You bring a lightness to my heart on this breezy October day. You show me such simple pleasure in your animated aliveness. Thank you for this reminder. As I now slowly walk by, I sense your invitation to join you in a carefree dance today. You ask, why not? And I reply, why not indeed? And that's something that keeps coming up for me, as I loved to dance when I was younger, and I have not been actively dancing on a regular basis for a number of years. Sometimes I'll get up and just move around to a single tune, but that's something I'm giving more thought to this year and into next year, about finding a way to express myself more through dance to music, because I love music. This one is called Interior View. And it was a neighborhood. These beautiful flowers were blooming when I was in the neighborhood doing some pet sitting. This was last spring. I am frequently drawn to photograph close-ups of the deep interiors of flowers in full bloom. I am in awe as I glimpse their extraordinary beauty. I feel an intimacy with the mysteries of nature when focusing on the blossom center. Frequently, I sense both potency and vulnerability residing there together. Sometimes the sensitivity felt at the center is in marked contrast to the boldness expressed in the outer petals of the blossom. These experiences connect me with both wonder and mystery. I just sometimes I'm filled with wonder when I look into that deep center of a blossom and just think how this came to be, how it came to life from either a little seed or a bulb or whatever. It just connects me with the wonder and awe in life. I fall in love with this living visual of nature's intelligence every time I'm drawn to this deep interior view. I love nature. I love lots of nature, but trees and flowers are my very, very, very favorites. This one is called Mossy Realms, and I was given a trip to these islands that are they're west of British Columbia, and a friend took me up there probably about 10 or 12 years ago for a week or so. I can't remember how long we were there, but it's quite a ways off the mainland. We were on a ferry all night, but it's just kind of a magical land there. This is what I wrote from this. This is what this scene said to me. Welcome to this mossy realm in the Haida Gwaii Islands. These islands are part of Canada and lie west of the mainland. The bountiful rainfall supports an abundant growth of multiple shades of green, cushiony moss. I find myself on watch for a gnome, a fairy, or Peter Rabbit to suddenly appear. This landscape stokes fantasies of a vast assortment of woodland creatures in residence. I sense an otherworldly presence here. This mossy realm grants human visitors the opportunity to recall an earth-centered time and tempo that prompts my body to sigh with relief. And then this is the last one that I chose today. This is called In the Forest, and this is at a park, one of the parks within the city limits of Portland. And I used to live right near this park where it was a real healing time for me. I lived in this tiny, tiny studio apartment that was attached to a residence. It's what I could afford, but there was a 20-minute path that led down into this park. We were right adjacent to the park. And so I was surrounded by trees. And I think this is during that time period. I was there about 12 years. I think it was during that time period that I really began to deepen my connection with trees and fall in love with trees. And I really, really feel like during that time period, the trees helped me with a lot of healing, just being close to them in the forest. Oh, and so I hadn't been there for a few years, and I went back on a walk with a friend, and they've put these little rustic benches, wooden benches at different places throughout the park now. And I love benches. I have lots of photos of benches and places and pretty chairs and whatever, because they always remind me about pausing in life. I take a seat in the forest and feel a sense of safety and belonging. My feet rest on the ground beneath me, and I feel into the sensation of the earth supporting me. I am surrounded by tree sentinels and am soothed by their companionship. I hear numerous birds singing to this morning. Some sing to announce their presence, and some sing out of sheer delight in hearing their own voices. I feel a deep curiosity to know this forest world better. I feel a deep peace here in the forest, believing that each person who resides here, or each being who resides here both belongs and contributes. I bow. And that's all the slides for today.
I loved all of that, Elaine. I connected with so many different things that you said, especially with the vulnerability of stripped bare of the tree and reflections on a fall day. It was very, very moving. Thank you for sharing that with us. And you just have a wonderful way with words. And I think a lot of us have that sensitivity that you spoke of and how to cope with that. So thank you for sharing that.
It's a way of connecting with our hearts. I see that however we express whatever creative image, whatever form that comes out within us, we're sharing our heart. We're responding to whatever our heart is drawn to. And when I was when I was a client doing my trauma release work, that was another. There was many. We don't have time today, but there's many points in this juncture of learning to expand my relationship with my own brand of creative expression, or how I see the world in creative ways. And she had me start bringing in these cards. There's a process that I took a class and then trained to be a facilitator quite a few years ago, right when I retired. And so she said, well, why don't you bring in so I'd bring in one or two cards. And she said later that she could see so many more parts of me through these images that I collaged on these cards than what I was verbalizing around the issues that we're dealing with. And she said that's what helped our work really go along pretty rapidly and smoothly, because I got to see more of who you really are. So that was very reinforcing to me about how that expression of, our creative urges, expression of our hearts is a way of connecting with our wholeness, expanding our experience, even when we're going through challenging times.
Yes, absolutely. So that leads me to the next question I was going to ask you is, how can people find your work and get more involved?
Well, I sent you some links to my website. My website is Navigating Life with Fibromyalgia, and then to my Facebook page, which is Facebook.com/Navigating Life with Fibromyalgia. Will you be putting the links somewhere with the video, do you know?
Yes, we will.
Oh,
We'll make
okay.
sure that everyone has access to that.
So those links, yeah. And then there's what other link do I want? Oh, and also there's a link. I'd love to hear from people if they have any questions or just hear your experience with creativity. There's a link also to the contact page on my website so that you can directly email me. And don't hesitate if there's questions you have or things that you want to share with me about your own creative expression. think that was all. Oh, yes. And then the other thing I wanted to tell people about is I did write an ebook I published back in 2017 through Amazon. And I can periodically set up like free days for free downloading. So I've set that up with Amazon that begins at midnight on December 1st and ends at midnight on December 5th. And, if I had the energy, I would update the ebook because it could be updated because I'm a different place in my journey now than I was, in 2017, but I don't have the energy to do that. But there's a section in there, and part of it, there's a section where I talk a lot about creative expression and all of that too. So that might be helpful to people, another way of learning more about me. But I'd be really happy to hear from people. And, I've done groups for a long time, support groups around, the physical, emotional aspects of supporting with fibromyalgia. And I'm playing with ideas about how to put that in a format where we come together and we're just focusing on creative play for short periods of time. And maybe not doing the play while we're in session, but coming and sharing, seeing the sharing of all the different forms of creativity that come through people and just reinforcing each other that we incorporate that. We make some time for that part of our lives. So that's I'm working on that. And I'm also working on, I thought I would have it launched this fall, but I ran out of energy, launching a YouTube channel where I hope to interview other people, bring other people on, talking about their forms of creative expression. And again, just reinforcement of that, because it's not something that's really, I don't feel it's, uniformly encouraged in our culture. And it's a very powerful resource. It's a very powerful resource for helping us feel better.
Well, I look forward to you doing any and all of that. I think you have.
I just need a helper.
Here I am. You have such a kind spirit, and you're very warm and inviting. Immediately when I first talked to you on the phone, I just felt very connected, and there was no judgment, and I felt like you and I were friends. And I think you bring that to the table, and along with your creative expression, you really make us feel comfortable and at home, like we have been friends. And I think that goes a long way when dealing with a condition as fibromyalgia.
Oh, thank you. I also want to mention here that part of my support, the ways I've supported people, is around tuning into practices of self-compassion too. I'm a firm believer in routinely speaking to ourselves with kindness and hands to the heart, because that releases serotonin in the brain. They found that connection with our heart center, that physical connection. So anyway, I'll stop because I can go on and on because I am passionate about this.
Yes. Well, thank you for that reminder, because we do need that. So before closing, was there anything you would like to tell someone struggling with fibromyalgia or another chronic condition?
There's many things, but, a physician, thankfully, way back when, a physician planted hope for me. He was a physician who diagnosed me, actually. And my journey started with an auto accident. I had wonderful health before that. It started with a head-on collision, auto accident with serious injuries. And a year and a half later, when I wasn't progressing beyond a certain point and had, incapacitating headaches and pain throughout my body and fatigue and sleep disturbance, I was diagnosed with fibromyalgia. That was in 1989. It's miraculous that I encountered a physician who was able to diagnose it then. And he basically referred me to a warm water aerobics and gave me a prescription to help with the sleep disturbance. And then said, but that was it. And then and sent me to a trauma counselor for 4 sessions. Mainly, I went there and cried. I just did a lot of grieving there, but because my life had just changed dramatically so quickly. But he did say this condition can improve over time. I hung on to that. He did not tell me how. I had to discover my steps along the way. And I think that's true for, a lot of us. Thank heavens for people like Support Fibromyalgia Network and many more resources available out now to support and help people. But, he at least planted that seed, and I see the power of words. He said, this condition can improve with time. So I was on the search. After that, and lots of experimentation to see what would work for me, because we all have our individual paths too. But don't ever give up hope. Don't give up a hope. And, forming community like what you're supporting here, forming community around the world. I mean, how fortunate we are. I didn't grow up in the time of computers, but I just feel so happy that I have access, with connections, with support, people around the world that are dealing with this similar challenge. I mean, it's fantastic. So connect in, don't isolate, connect in, reach out to the places that feel right to you in your heart. And you can feel better. You definitely can feel better.
Well, I think you were an excellent example of the power of words from the beginning of this interview all the way through your sessions and to the very end. So thank you for sharing all of that with us and giving us hope that we can find something that works for us. And we will be connecting with you. The entire community, I know, we're going to be connecting with you to be able to do some of this creative expression. It was very powerful of what you did. So thank you again for sharing your journey and all of this with us. We appreciate you.
Thank you so much, Brandy.
Thank you, everyone, for listening. So come back into the chat, continue to chat. Let us know where you're tuning in from. Please share this stream. We are getting ready to come back into doing another presentation as well. So please stay posted for this. I'm going to I'm going to come back on stage. Okay, I loved this. Thank you so much, Elaine, for this wonderful presentation. I know you're connecting in the chat, and we have people connecting with you as well with everything that is going on. So don't hesitate to reach out. Remember, we are a community. We care about you. You are not alone in any of this. Right now, hello to all of our YouTube, Facebook, and StreamYard guests. We're going to have a very special presentation next as well when we play this from Dr. Kaci and Dr. Loren, who are backstage right now. We're going to showcase their presentation, and then we're going to bring them on for a live Q&A after the presentation. But before that, I just want to give everybody an overview of some of the itinerary that is ahead for the Fibromyalgia Community Conference. So our next presenters will be here shortly, and then after them, following them, and I'm trying to get my time zones correct of what we said. So 2 p.m. Eastern, we will follow the next presentation with Kelli from More Than Lupus. She's going to have a fantastic presentation on patient advocacy. We're going to talk about support group services and other ways to get involved. Then tomorrow, huge shout out to Marco and Carrie. So we have a special matinee presentation interview with Marco. You're going to learn about his advocacy work internationally in Spain and also his work as a man living with fibromyalgia and his perspectives. And we saw him earlier talking about he's already invested in his health and healing and how he does it. So tune in tomorrow at 2 p.m. Eastern for that matinee presentation. It will be streamed on StreamYard. It will be Facebook and YouTube as well. Same channel. So wherever you're watching it now, everything will be found. Monday at 12 p.m. Eastern, we have Jim from Patients Rising. He's going to be talking about the patient helpline, and he's a fantastic storyteller. We'll also be sharing all the services that Patients Rising offers to the community. It's been a tremendous experience connecting. And I know Danielle and I went to Capitol Hill and we connected with some of the other leaders. You heard from Frank on Thursday night. We're advocating for healthcare. They have a podcast as well. So we'll be sure to have you included in all of that information. Danielle, did you want to come back on stage and share maybe a little bit about your experience with Patients Rising before we start the next presentation? Okay, let's bring you back. Hello.
Hey, okay, let me unmute myself.
It's a lot going on backstage. So I know that you joined us with Capitol Hill, the importance of advocacy work. So sharing your experience is important a little bit. We were walking around and all of that, but was that the first time you had done a Hill Day?
Well, I've done virtual ones, but that was my first time in person, and it's way different to be in person. I do like virtual better because I have issues walking, but yeah, it's just a different experience. I do think Patients Rising has a class, and so I you introduced me to the class, right? So taking that was just so much helpful. It just made me more confident being able to speak to the senators and representatives. So definitely gonna have Jim, shout out that class for everyone.
Yeah, we'll share the link because that advocacy masterclass really helped. It's expansive, and then you get to learn about things that I wasn't really aware of.
Yeah.
So this is healthcare policy advocacy. I know we go for fibromyalgia advocacy to Capitol Hill, and we're advocating for increased funding for fibromyalgia. But this is like top level for Patients Rising. We're all different chronic illness conditions coming together. There's caregivers, there's everybody, all the supporters. We're all there on Capitol Hill together advocating for change in healthcare policy.
Yeah, well, they teach you so many other ways that you can advocate that I just had no idea even existed, that like I could actually affect change, make change happen like in the government. I'm like, I didn't know that existed. Like I could actually be a voice for people with fibromyalgia, rare diseases. Like I have rare disease, I have fibromyalgia, I have a birth defect, so I do want to be a voice for those people. And now the class gave me the resources to be like, well, here's a board you can go speak at. Like here's your local place you can, blanking on the words, of course, 'cause brain fog, but we'll have Jim maybe say some, but like, some advisory boards that you can go speak at, and like they teach you how and exactly what to say and stuff like that. So it was just an incredible opportunity.
Yeah, and we'll be sharing more of those resources, and Jim will be able to explain everything in the services and the importance of it. He's going to give us information on the patient helpline even more, because I know that a lot of patients utilize that to access different tools and they answer different questions and support patients, which is huge, like finding transportation services, other services for affordability of anything, of medications or tools that you might need, like mobility devices. So it's a tremendous resource. And you also can listen to the Patients Rising podcast. I think that comes out weekly. I'll have to check and we'll have to ask him. That's why we'll have a great conversation on Monday. So that's 12 p.m. Eastern. We still have a special announcement of what we might be able to do on Tuesday. I am taking a microbiology and biochem midterm, everybody. So this is why there was a change in scheduling on Tuesday to make sure that I could take my exam. And thank you for allowing me the space to do that with a whole lot of stress. I couldn't stream at the same time and take an exam. So I think we will either, I don't know, we'll talk about it, Danielle, because I was thinking about a flashback of last year, maybe some of the top streams and videos, because people have been asking questions. So hello. Keep on coming in and sharing the stream and joining us, and let us know where you're streaming in from. We have a full day ahead. And how could I forget? We have the evening too.
I know. I was going to say, tonight. Everyone's
missed
gotta
it.
join in tonight.
Yes. So once Kelli is complete to presentate, we're going to take a little bit longer of a break, and then we're going to come back to 6 p.m. Pacific time, and then 9 p.m.
Eastern. Yeah.
We're doing a live stream from Taiwan. So our friends from Taiwan, and we have Carrie who is co-hosting that for us. We're going to be streaming live. So tune in from there. I think we have maybe Club Insomnia will light up with some potential music, or the pause for Fibro, my DJ. I don't know. I don't know what's going to go on. So
It's
you
Saturday
guys,
Night Live. We don't know what could happen.
and we're live too. So
Right.
anything could happen. And it's so good. I'm glad you emailed. Yes. I'm glad you emailed about the giveaways. We'll try to get better at the giveaways. Hello, Crystal. It's good to see you. And she's definitely leading the crew with the Pause for Fibro and Veteran Voices for Fibromyalgia. Crystal is presenting on Friday, next Friday, so December 8th. And we do have Cody's fan club who will be making an appearance. She helped us negotiate the writer. So we have all the treats in line for them so that they'll be ready to go and dialed in. Okay, so we're going to introduce our next guests with an introduction. We're going to play the presentation, and then they're going to be back for the live Q&A. So Dr. Kaci is dedicated to delivering compassionate, holistic chiropractor care using a unique upper cervical technique. She loves bringing hope to patients who feel discouraged by the healthcare system, especially children and mothers facing challenging health decisions. Dr. Loren specializes in treating chronic conditions like digestive problems, hormonal imbalances, sleep disorders, and migraine and headaches through specific upper cervical adjustments. So we're going to learn a lot about what this means in the presentation and through the live Q&A. She was a former gymnast and track athlete. Dr. Loren understands firsthand how health issues can prevent someone from enjoying their passions. After suffering a concussion in chiropractic school, she experienced the benefits of upper cervical care herself. Her goal is to empower patients, especially women, to take control of their health. I'm delighted and thrilled that they could join us. I love that they're in San Diego too, so not far from me. So let's get their presentation started. And Danielle, we're going to go backstage and let the presentation run, and then we'll be back shortly.
Hi, I'm Dr. Kaci, Madden. I'm grateful to be able to be here today to share about how this discipline, specifically upper cervical chiropractic care, has been able to provide success for my patients who've been initially diagnosed with fibromyalgia. First, I want to start off with saying thank you to Melissa for providing this space for practitioners and providers, for people to come together and share their information and support each other. I love the name of this event, the Fibromyalgia Community Conference, because we truly are a community with each other, and it's only through working together that we can rise together. So instead of just jumping right into the topic I prepared for this hour, I wanted to start off with an exercise. You may have done it before, you may not. It feels a little bit funny. So if you have the ability to, go ahead and stand up with me in your room. And you're going to stand with your feet together, eyes closed. Just feel how you feel. And if this is too much, if you feel like you're going to fall, open your eyes right away throughout any part of this process. So initially, you're just going to have your eyes closed. Just see how you're feeling. Are you swaying? Are you wobbling? Or are you staying nice and centered? And with your eyes closed still, you're just going to start marching in place. And you're going to march in place for about 10 to 15 seconds. And again, if you feel like you're going to fall at any point, open your eyes right away. No falling with this. All right, and go ahead and open your eyes and see where you ended up. Did you move at all? Was there any lateral movement? Was there any rotation? Any kind of shifting? And you can keep standing or you can come back and sit now. I'm going to explain what that is in about 10 minutes in this presentation. But drop in the comments below, how'd you do? Were you straight? Did you go forward at all, or did you stay right where you were? Or like I said, move laterally to the side or rotate at all. So I want to start off making sure that we understand the goal for this presentation. I'm sure every provider here has a similar one, but we want to make sure that you feel empowered to make informed decisions about your health after this. I'm sure by default, since you're already here attending this conference, you are one of those people that already feel that same desire of ownership over your own health. You'll be getting lots of tools, which I love, and all these different modalities here at this conference to help you with the healing process. And we're going to break down why this piece, upper cervical chiropractic care, is what I think foundational for this fibromyalgia diagnosis. So I'm going to be reviewing what the technique is, why upper cervical is different than general chiropractic, what the process looks like for the healing, and we'll nerd out a little bit on the science behind the whole thing and why it's so effective with fibromyalgia. There's only 1,200 doctors in the world that specialize in this type of care. And in the end, I'll be providing you with a list I've compiled of practitioners that I have vetted myself personally that are around the world based on previous social DMs, comments, and calls I've received looking for specialists within other people's areas as well, mostly in the US, but some international as well. So in an effort to not repeat something you've probably heard thousands of times, I'll briefly just touch base on this because it is relevant to how we're going to start. What is fibromyalgia? Well, if you break down the word, it literally means tissue or neural tissue pain. I only begin here to make the point that the nervous system, which is what controls and coordinates all function in the entire body, is what upper cervical care is all about. So we'll first start with what upper cervical care is not, and then we'll move into what it is, what it looks like, and why it changes lives. So upper cervical care is not aggressive. It doesn't produce that loud cracking noise, and there's definitely no rotational force involved. It's very precise, very specific, very low force, and it's different because we utilize objective measurements, specifically infrared thermography, to measure progress each visit, pre and post correction, which allows us to know when to adjust and when not to. So we're not always correcting every single visit. And I'll get back to how we do that, why it helps with fibromyalgia specifically. But to understand the impact of the symptoms that are associated with fibromyalgia, I first want to take a step back to look at, again, what I said, chiropractic or upper cervical chiropractic is not. And just like every profession, there's good and bad.
My hands here?
No, you just put them right here on your tongue. Okay. And just keep your teeth together. Breathe through your nose. There's got one more. Had to do a double dinger on you today. You felt it all the way down though, didn't you?
Again, like I said, not every chiropractor is like this. Majority are not.
Teeth together.
And just like every profession, there's good and there's bad. Unfortunately, frequently when people hear about chiropractic, this is kind of
do a double dinger on you
or
today.
that laying on your back,
You felt it all the way down though, didn't you?
as well, rotational force. Neither of which upper cervical does whatsoever.
Together.
Nor majority of chiropractic. Unfortunately, we get a bad rap. So going on to why chiropractic started in the first place, just a really brief intro, because this is actually something that is how it initially began. Thomas Edison has a quote that is pretty similar to what BJ Palmer, who's like the developer of chiropractic, was in line with as well. They were alive at the same time, and his quote is, "The doctors of the future will not dose us with drugs, but will instruct his patient as to the cause and prevention of the maladies." So this was a newspaper clipping from 1902. And obviously, I'm not saying that medicine's not the only way. There's always a time and a place, but it's not the only option. And I believe more people are realizing lifestyle changes and preventative measurements are playing a vital role in the recovery and healing process now. But going all the way back to the origins of chiropractic, before majority of the world understood it, the importance of it, BJ, like I said, developer of the profession, surmised that the life force and the most important thing to affect within the body was the nervous system. So the original, going back to the very beginning, original intent of chiropractic was to help facilitate the healing process that everybody's body has the capacity to do by affecting the nervous system. Because again, your nerves are what control and coordinate all of the function in the entire body. So if they're not functioning well, your body's not functioning well. And I'm going to explain a little bit more in detail about this right now, but I'm going to start off with some analogies, just because I think analogies are easier to understand and I like them. So what does the nervous system look like? I say it kind of looks like an information highway. I like describing it as that because it's an easy way to understand what the nervous system is. If you're thinking of the highway being your nerves or your spinal cord and all those little cars being the signals that your body is sending to your brain and vice versa, brain to the body. The nervous system, again, is what controls and coordinates all of the function to and from. So if it's going well and there's no traffic jams, it looks pretty nice like this. But a big factor and why we believe upper cervical chiropractic care is so helpful and effective with what we're talking about with specifically fibromyalgia is this fuse box right here. So we believe upper cervical means these top two bones, upper cervical being the cervical bones in the neck. Upper, these top two, atlas and axis, are pivotal because they form what we call the fuse box of the body. So like I was saying, every nerve in your entire body controls the function, but every nerve in your entire body goes through these top two bones right here, besides your cranial nerves, before they go to the brain, or from the brain to the rest of the body comes through these top two as well. So your brainstem sits right here on top of it. And this is a really good, easy, actually pretty comparable example of all the nerves and how they go throughout the rest of the body and what we call the fuse box. So if you're thinking of a kitchen or somewhere in the house where you've got a lot of different things like appliances, and you walk in it and the toaster's not working and the dishwasher's not working and the stove's not working and the lights aren't turning on, do you think I need to probably go change the light bulb and go check on the dishwasher and fix our fridge and all these different things? Do you make a list of all that? Or do you think there's probably maybe a source where all this comes together? The fuse box. So you go in, you check the circuit breaker, flip it back on, and now everything works again. And imagine, as you typically experience with fibromyalgia, obviously it's all over body pain as well as fatigue, but you frequently are also experiencing difficulty with memory and sleep and digestion issues and temperature regulation difficulties and anxiety or some other autoimmune issue. So how likely is it that you have all these issues at those end organs versus there's somewhere that they all could be affected, the fuse box? So that source, if it's addressed, could be massively beneficial. So that's what our thought process is with upper cervical. In the body, we take that approach. When the whole body is being affected with multiple symptoms, we look to the space where everything comes together. It's kind of like the telephone game. If you ever played that as a kid, you started with something, you said a sentence, your brain sends a signal, and it goes all the way around the circle. And by the time it gets to the end, it's something totally different, or vice versa. Your body sends a signal because you have ascending and descending different neural pathways. So if the incorrect input is being sent, then the body is sending the incorrect input, then the brain is outputting incorrect output. So going back to the telephone game, or back to the walking test that we did earlier at the very beginning of this, remember, we had our eyes closed, so we were no longer getting this signal or this external stimuli information for the brain to process, and we were only getting information from marching, or what's called proprioception, how we know where our body is at in space. And this signal goes up to the cerebellum for the cerebellum to input and understand where we're at in space. And if you were staying put without moving at all, pretty good sign. But if you saw some lateral rotation or just lateral movement in general, then it's a sign that one side of the signal is stronger than the other. Your brain is getting a higher amount of signal from one side than the other. And so then you see that shift. And that's just one example of body-brain connection potential dysfunction happen. So the question becomes, what causes the nervous system to not function optimally? Why does that aberrant movement occur in the first place, right here in this fuse box area? And the answer is stress. But it's not just stress itself, it's the body's response to stress or response to the external stimuli. So it actually comes down to your nervous system's ability to adapt. Because many people will say they're stressed, and some things that people feel stressed about, other people don't, and vice versa. When you think of stress and your nervous system and how it correlates, I like to describe it like, again, an analogy. 2 cups of water. And if your nervous system is functioning at 100% the way it should be, it's like having this tall glass right here. You can pour a lot of water into it before you see it get to the top and then overflow. It could take on a lot of water or a lot of stress. Similarly, this tiny little cup over here, right here, if it gets filled with water or filled with stress, because it's so much smaller, the nervous system's not functioning as well, any amount of extra stress causes an overflow immediately or an overflow of symptoms quickly. So bringing this back to fibromyalgia, what could cause this to happen when you're stressed, when your body's not able to adapt to these stressors well? Well, the Mayo Clinic defines fibromyalgia as widespread musculoskeletal pain that they believe fibromyalgia amplifies painful sensations by affecting that your brain and spinal cord process those signals. And symptoms often begin after an event, aka stress of some kind, physical trauma, surgery, infection, psychological stress. And they frequently have, people who have fibromyalgia also have multiple comorbidities, headaches, TMJ disorders, IBS, anxiety, depression, and all of this makes sense when you relate it back to the nervous system. So as I was saying, stress, it's not just physical stress. Highly frequently that is the case. Some kind of trauma of some kind, or what they call repetitive traumas, repetitive stressors. Sitting here texting with our head bent forward like this all the time, putting strain and stress on the spinal cord right there. But psychological stresses or mental stresses or emotional stresses are also involved, and they can cause physiological changes. Think about it. If you were pulled over or you heard sirens turn on from a cop car behind you, even if they're not pulling you over, you hear this, at least for me, I hear the sirens and I immediately start to have my heart rate increase and I start to feel like I'm getting a little bit sweaty. I'm having a physiological response to something that is not actually a physical threat. I mean, it would not be great if you got pulled over, but it's not a physical threat. It's a mental construct that you created about, oh no, this is not a good thing. Same thing if you're a student and you're prepping to take a test and maybe you have a little bit of test anxiety and you don't do it great. You might have a physiological response to something that is, again, not a physical. It's not a tiger attacking you. It's not something actually physically happening. So your body is dropping into that sympathetic state. So your body has a sympathetic, which is that fight or flight, right? When you're ready to run, or unfortunately, sometimes you just freeze. And it has a parasympathetic space where that's what's called rest and digest, and that's where you're healing best. So when your body is not able to adapt well to the stressors, the trauma that it experiences, that's when we see dysfunction start to happen in the nervous system. And I'll give you an example, just a quick rundown breakdown. This is a physical trauma example, but this is what can happen. Any form of external stimuli that the body can't adapt to, trauma, causes disruption of the normal biomechanics of the upper cervical, these top two bones right here, complex. So the biomechanicals get shifted, which can cause hypo, meaning less mobility, hypomobility, which then turns into adhesions and fixations of that joint. So hypomobility, it's not moving as well, causes altered motion. So not the correct biomechanical movement that you're supposed to see. Altered axis of motion, which causes altered stress on those joints because it's not moving the way it's supposed to. It's aberrant movement happening. And again, causes hypo and hypermobile joints. So hypo less, hyper more. Because of one that's not moving well, then others around it have to start compensating and become hyper. All that to say, alteration of the sensory afferent from joints to and muscles to the brain. So you have the afferent, which is typically sensory or ascending pathways of the brain or of the nervous system, and efferent, which is typically the motor or descending, the brain telling the body what to do. So we're getting incorrect, altered sensory integration up to the brain. So wrong input, which is that afferent move or afferent innervation. So hypoafferentation and hyper, again, not enough signal in engagement and too much. Remember, like that telephone game, it's getting the wrong signal. All that to say, disafferentation, incorrect signal, which causes the altered global neurological function. So not just that one location, but because your nervous system, again, is like your information highway, you're seeing issues along the whole information highway and all the places that it goes to, those end organs. So just to do a quick example of what we're looking at, if we're looking at, this is a cross section of the spinal cord. If you were to look at the spinal cord and cut it and then flip it up, we're looking at the dorsal up here, so the back aspect of it, the front aspect of it here. And this is the point where the nerves come together to go up to the brain in the spinal cord. So as you see with the motor or that efferent descending tract, this is where the brain signals are being transmitted to the specific nerve or the end organ. And this gives us a view of different tracts and allows us to see how if one tract, like the lateral spinothalamic tract, which is what relays pain and temperature sensations. So it's this sensory one right here, these ascending right here. Temperature sensations and how they're being affected by that, remember, hyperafferentation we mentioned on the previous slide, where it's getting too much signal happening, could cause a spillover effect and interrupt other signals that the body is trying to send to the brain and vice versa, like the tectospinal tract, which is the movement of head, neck, and eye movements. Again, so this is the motor one. Now we can see how eye involvement frequently is seen with patients diagnosed with fibromyalgia and how that can occur. And like we just talked about in the previous slides, if the external stimulus input is shaping how the body externally operates, it makes sense that the pain stimulus that the body is sending up to the brain experiences multiple symptoms elsewhere as the cross-section at the spinal cord is being affected. So again, it's like that information highway analogy that we had used earlier. When there's a traffic jam along the way, there's increased symptoms that can be present. And apologize, this is my drawing, so it's not very pretty. Here's a better view of that nervous system. Cross-sectional views right there of the spinal cord going up into the brainstem from the medulla pons midbrain all the way up. So signals up to the brain with that spillover effect can cause a gamut of other issues that could start occurring within the rest of the body. Exactly why you see temperature regulation issues frequently with patients that are also experiencing fibromyalgia, because that's right there at the brainstem, all the autonomic or automatic things that happen in the body that you don't have to think about or you don't have to voluntarily create to happen. It just happens without you even thinking about it. And we'll just break down just one of these nerves, how it could be affected. You've probably heard of it, the vagus nerve, or there's a great book, Polyvagal Theory, where they talk about how the vagus nerve, all the things it innervates, how it affects the body, what can happen with it. It's got sensory, it's got motor, provides innervation to so many different areas. It's called vagus, which means the wandering nerve. So it innervates the skin, over the ear. It can have a cardio reaction with the ocular motion movement with it. It innervates the internal surface of the throat, helps with innervating muscles as well in the throat. So movement with that, smooth muscle, the trachea, gastrointestinal tract, regulates the heart. And we'll see later on some other ways of increasing engagement or innervating that vagus nerve to help increase the parasympathetic aspect. Remember, we talked briefly about parasympathetic is that rest and digest component of the nervous system. And it's also where you have that healing space. So you see an increased ability for the body to heal when it's able to drop in that parasympathetic space. So we've been addressing it throughout this presentation, but now we can do a deep dive into the specificity of why is upper cervical effective for fibromyalgia. We've briefly already talked about it, but multiple times. The signals that the nervous system send to the brain determine what the body experiences. And we have this tool called infrared thermography. It's this guy right here. It shows us computerized infrared thermography. So it shows us a graph that looks like this, and it measures the nervous system's function and allows us to see if the nervous system interference is present. So you can see on the graph here, we have a pre and a post scan. The pre is this blue-green color, and we've got a left side, a right side, and delta T, and these are the paraspinals. So you can see in this picture, it goes up the back of the neck, along the paraspinals, right up to the base where the brainstem is. And we're tracking and seeing how that left paraspinal, the right paraspinal, and the delta T, their average, is working together. And computerized calculated thermal asymmetry, which is what this looks like when it's not nice and straight. So if everything was working the way it's supposed to and there is full function, you'd see nice straight line right here on the blue, right here in the center, and right here on the center as well. When there's asymmetry, it's an indicator of dysfunction when assessing the nerve's function, basically. So like I said, every single patient that comes into the office gets this test done pre and post correction every single visit. And on their very initial exam, when they're coming in, we're doing a ton of these scans, pre-scans only, obviously, because we need to do the full initial objective assessment to see what's going on. So we'll do it after the patient's done their history. We'll do it after they've rested. We'll do it after movement. We'll do full back scans as well. We want to get a bunch of baseline data points to see what this patient's aberrant position looks like. And typically when they have what we call a pattern, it'll show up the same way every single time. And what we should be seeing, if it's working 100%, like the nerves are functioning, like I said, should be a nice straight line on that blue. So you can see the post scan is this purple color that we have going on. Post meaning after they've had the adjustment. So this patient had already been established under care. We already knew what the correction looked like after we saw the first scan. They were in pattern. Their body was in a state where it's non-adaptive and it needed the correction. Then we adjust, and then they rest, and then we scan again after, and we're seeing each visit pre and post how they're doing. So this is something, and I bring this up, if you do try to find an upper cervical chiropractor that's close by you, you want to make sure that they're measuring objectively pre and post every single time, because you want them to be precise with your care and base it off of objective testing. So another thing that we do when a person first comes in is imaging, obviously. And same thing with if you go to see another practitioner, you want to make sure that they are taking images on that initial exam for a complete view of the upper cervical complex. And it doesn't have to be this. This is a CBCT scan, but it could be digital x-ray as well. What we are looking for is, again, that aberrant movement. So you can see this is actually not a great looking spine because you're supposed to have what we call a lordotic curve or a C curve. Kind of like your bike shock absorbers. You should have a good C curve, and then the thoracic goes the opposite in kyphotic, and then the lumbar kind of comes back in lordotic curve again. But in the initial exam, we are always taking full view of what's happening in the space, as well as a biomechanical. So we take lateral views as well, because we want to see how the actual spine is moving in these positions. With lateral flexion, you should see specific motion in that top joint right there, because there's no discs in between C1 and C2. They just move on top of each other, and we should see specific motion with it. And if we're not seeing that, it gives us a little bit clue into how their body is engaging and typically not working well. So with that initial exam, we're doing scans, infrared thermography views, obviously orthopedic and neurological testing and history. And then during care, this is something that you should expect from other practitioners as well, resting post adjustment, so that the body can actually adapt to what they just experienced, that correction. The resting suite allows for the body to heal during that space, gives it a time to actually set and helps with the correction quicker. And then after they rest, that's when we do that post scan. So here's just a brief view of what the CBCT scan looks like. It's one of the tools that we use in our office. It's a full view, and it allows us to see, like I said, how the body is actually functioning or not functioning in that space. And from here, we learn what needs to be corrected. And the thermography, those scans that I showed you in the beginning, it shows us when. So this, you can see, just based off of this, you can see a little bit, and I'll pull up and slice it so that it's only the top 2 bones to see how it looks. But you can see when we pull it and take that cross-sectional view right there, you can see how C2 has shifted slightly, and inside on that spinal canal, there's a little bit of decreased space right there. So I'll pull up a little bit more in a moment. And again, with this form of care, you should not be getting adjusted every single visit. So right here, you can see on the inside, a little bit less space happening right there. And again, it's not that the bone is touching the nerve, but that incorrect malposition right there is causing inflammation in the space. And the inflammation is what causes that disafferentation, which, remember, just meant the signal is not making it the way they're supposed to, which is typically how you feel when you have fibromyalgia. So our goal with this care is to help facilitate the healing process by helping your nervous system function at 100% again. And like I said, if you are looking for a practitioner near you, I've provided a list. I'm not sure if you'll be able to have these slides, but if not, I can still provide it in the Q&A. And majority of the patients or majority of the doctors are in the US, but I do have some that are international. And like I said, there's only 1,200 doctors in the world that do this, so it's not a super common line of work. So if there's not someone near you, here's some things that you can do on your own to stimulate the parasympathetics to help at least slightly with your healing process. So like I said, the vagal nerve helps your body drop into that parasympathetics, and there's a few different ways. You can also read, like I said, the polyvagal theory book has all of these basically. But the oculocardiac reflex. So pressing on the eyeball helps with that engagement. Humming, especially at a certain frequency, helps because that's where all of those, with the vagal nerve innervates all of those muscles in smooth muscles in the throat area. Pulling on the ears and stimulating the skin around them, again, because that's where the vagal nerve innervates. Breath work, inhaling for 4 seconds, holding for 7 seconds, exhaling for 8, because that is the diaphragm, again, innervated there. And then thought exercises, and these are the ones that people think of when they have anxiety, especially. It just helps you integrate all of the senses and integrate the communication with the brain. So 5, 4, 3, 2, 1, 5 things that you can see. Name 5 things that you can see, 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste right now. And that just helps you ground and kind of get in that anchored space. But then anchored is a separate one. And that one is helping you create that neural pathway, because your brain has what's called neuroplasticity, where it can change itself, which is a beautiful, incredible gift that we have the ability to do. But anchored is when you imagine time where you felt joy, where you felt safe. And then again, using your senses, draw what that felt like, draw that room if you can, use colors if you can, talk about the smells, like write everything down. As many senses integrations as possible. Things that you felt like you touched. It was a rough space. It was a rough chair or a velvety chair. And then things that you could smell in the room. Maybe it smelled like pumpkin spice because it's the season. And things that you saw, anything that you could hear. And then again, writing something if you could taste it. And writing it down, actually doing that, helps so that if you ever feel the need to try to get back into that space where you're nice and calm, it brings it to it quicker, because you have now done all the sensory integrations with the memory of it, but also written it. So you're using kinetic movement to help anchor it and stabilize it and help it stay nice and integrated with the brain too. And overall, in the end, I just want to leave you with hope. I want you to know that you don't just have to live with it. And I know that's why you're here. I know that's why you're going through all of these different presentations and learning more about how you can help yourself heal, because you do have the ability. Us, at least upper cervical chiropractic care, and I'm sure a majority of all these other practitioners, are just facilitating the process. Your body is doing the healing, and we're just helping it do that as much as it can. So you have the power within yourself to heal. Your body was made to heal, and given the chance, it will. Thank you. And I will now open it up for any questions that you might have, as well as my resource page.
What a wonderful presentation. I appreciate it. And I want people to chime in too, what your experiences are. Please have your questions because I know we're going to dive into differences too in what was just presented versus maybe some of your other experiences with chiropractic care. I'm going to bring on my co host, Danielle, backstage. Welcome back to the stage, Danielle. You got a chance to watch the presentation, so we're going to dig into some live Q&A. Dr. Kaci and Dr. Loren are backstage right now. Give me a thumbs up from backstage if you're ready to be pulled onto the Fibro stage. Perfect. So let's bring them on board. Hello, hello. Welcome to the Fibromyalgia Community Conference.
Thank you for having us and having this incredible resource for everyone internationally. This is beautiful.
I know we have so many questions too, and I appreciate this presentation because there's a lot of information for fibromyalgia patients, and it gets confusing because there's top level terms, and we talked about this with Jill too when it comes to fascia release, yoga, Pilates. So some of us like hear those, and we just go and do the modalities, and there could be a lot of pain that comes from it because we weren't asking the right questions, or maybe understanding the differences to the type of care modalities. And I do know that you both, like in the presentation, it was mentioned again, and it might sound a repetitive question on the upper cervical technique, but with chiropractic care, this is something that's unique that we would ask for. Is that what I'm hearing from the presentation?
Correct. In terms of chiropractic as a profession, there's actually like over 100 different techniques. There's so many different ones. And upper cervical is a different one that, again, specializes in just those top two bones. And there's different types of upper cervical. There's Blair, Nuca, knee chest. So like you were saying, there's a lot of terminology. So best question if someone is looking for someone who's more neurologically focused and helps with chronic conditions like this is upper cervical specific.
Okay, so it's more we're focused then on a lot of the neurology of this and potential with the nervous system. I love your diagrams. You're helping me study for not the Tuesday exam, but I have 2 weeks in AP, and this is exactly what it is because they have the same acronym. So the afferent and efferent because it's sensory input. So thank you for helping me study as I was memorizing the diagram there. Because when we talk about fibromyalgia, it's complicated. And I think sometimes with presentations, we forget that the system is all connected together and the nervous system and how it goes from the brain all the way down. So it's important to have this distinguishing features and talk about it as a whole. So, and that's what you do too. You emphasize the whole nervous system.
Yes, yeah, that's exactly. It's a little bit difficult sometimes for our patients because obviously we do mostly just neurological chronic conditions, fibromyalgia, migraines, headaches. People are like, okay, that makes sense. Fibromyalgia is a little bit more because that's whole body issues, but we also even have just like only low back people, and it's a lot of patient communication and helping people understand we're not actually touching anything localized down here because that's not the issue. It's not a musculoskeletal problem. Sometimes it can be, obviously. That's why we do all those testing up front. But if there is a neurological involvement, we want to address that main space right there where every single nerve in your entire body goes through, where that dysfunction is happening. And that's what our test is with the infrared thermography scan. That lets us know if someone's a candidate or not. And I will say every patient that we've had that's had fibromyalgia has neurological dysfunction, and it's 100% right there.
Well, I liked the scan. Oh, go ahead, Danielle.
I just wanted to say, like, this is really fascinating to me because I've been always scared to go to a chiropractor because I have rods in my spine. So I never wanted them to, well, they never even wanted to touch my spine because, there's rods there. I don't have it in my neck. So, that would be great to be able to have that capability.
Yes. Yeah. And kind of what I was referencing in the presentation, you definitely want to make sure you're with someone who's specific and doing all those initial tests to understand where and why the correction needs to happen and when. That's the biggest thing. It's not just like every single time you come in, you're getting a manipulation because you want to make sure they're being as precise as possible and specific. Just, like everybody, even though majority of people who are experiencing fibromyalgia have very similar symptoms, there's so many different types because everybody's body is different. So you want to make sure you're being addressed personally. And yeah, rods in the spine, if you are trying to do anything, you shouldn't be doing full spine for sure, but we've had patients with like C3 and down rods because we're super specific and precise and we're not doing any other movements besides those two right there. So, but that's, I'm sorry, so tough. Is that when your fibromyalgia started after post-surgery?
Well, yeah, it was after that, but I also have other surgeries, so I think it was all the surgeries.
That's a lot of trauma to the body.
Yeah.
Well, and I think that's why we want to share there's specialties within specialties because it's, you could have the fear of going to certain, as you demonstrated in your video, of stuff that might be like, okay, that is way too much. And with sensitivities, as we discussed, even for being touched or how to progress. So for this treatment and process, are there specific fibromyalgia patients that it might work better for, or is this something a good area if someone wants to start in chiropractic care, this is a good area to start? Or are there people that maybe should wait a little bit longer before approaching this?
Yeah, great question. I would say if you have hypersensitivities, like a majority of patients do with fibromyalgia, but you want to start off with someone who's less invasive, less forceful. So, Loren, do you know of other techniques within chiropractic that could be potentially beneficial? Maybe AK, that's a little bit softer, or DNFT.
Yeah, DNFT, or I was going to say NUCA, which is another upper cervical technique that is a little more gentle than what we do as well. It's very similar, but definitely for people with a little bit more sensitivity, that's a great option as well.
Okay. And then for those that are interested, like what's the signal to approach versus so maybe they don't have as much hypersensitivity, but what would make them come to you, like if they're noticing certain aspects of fibromyalgia that they want to get relief in?
Sorry, go ahead, Loren. I apologize. I saw someone else's comment and I was gonna respond to it after that. Go ahead.
Can you repeat the question really quickly?
I'm trying to get more information on maybe like what's the signal for fibromyalgia patients then to proceed with more of the upper cervical technique and come to you?
Yeah, like Kaci was mentioning in the presentation, it's the concept of stress. And so typically people come to us when either they're having to like miss out on certain things or they're experiencing increase in symptoms. Like a lot of people are having to like miss extra time with family, etc. And those are usually cues to people like this is not normal. This shouldn't be part of your normal reality. And so if your symptoms are causing things like that, that's when it's maybe time to get your nervous system checked, because a lot of times people are triggered by certain things, like the classic migraine when people are triggered by caffeine or things like that. Like those kinds of things don't have to be part of your reality. And so if some sort of day-to-day thing is causing extra stress, as compared to like how it used to be or as compared to others, then maybe that's a time that your nervous system needs to be checked.
Okay, so for that feeling, okay.
And I apologize. I was writing in the comments those names so people could reference them later, the different types of chiropractic. So I was writing the NUCA, DNFT, AK, upper cervical, and I had seen the comment previously, and I just wanted to respond to it briefly, if you don't mind, from, I think, Kelli. She said she received a pinched artery and then 6 strokes from chiropractic cervical adjustment for pinched nerves. And I don't know if she can respond to it or not, but I'm assuming it was probably what they call a rotary break, which is the one when you're laying on the table. They probably didn't do any imaging to make sure there was no contraindication for a correction. And they probably just did the manipulation where they do the side to side, kind of like typical, what they call diversified chiropractic. And I agree. I stay away from that. And I tell most people to stay away from that as well.
So that might be too intense for fibromyalgia patients. Again, we're trying to distinguish
Don't do that.
the approach because it's very much a spectrum. There are people that I have met that do have fibromyalgia that can handle a lot of the adjustments and things like that. And there's those of us that might have to approach it with baby steps and understanding and learning. So it's just a good outlet to give people resources on other modalities that they can try. Because I didn't know, I was not aware. I thought chiropractic care had one way of doing things, so that was not going to work for me. And I think Danielle feels the same way too. So
Yes, and Vita, maybe that's how she says it, just said activator, or I think that she meant activator. Yes, that is another low force, more gentle opportunity within chiropractic too. And I also dropped the link to that resource I mentioned for other upper cervical doctors that I've vetted throughout the US and internationally as well, actually. And that's in the comment section if someone's looking for someone that's near them.
oh, that's fantastic. And you're streaming in from San Diego. So anyone
Right, and
in
local to you.
well, anyone in San Diego too, it's definitely a great resource because we do get asked a lot of like resources. Do you know anybody? Do you treatments? And we have everybody's looking for a fibromyalgia expert, which there's unicorns, I think, for MDs maybe, but we need different resources and we need to feel and improve the quality of life. So looking for other aspects in treatment that we can actually apply and go to locally is important. And I do see the comment on hypermobility, which actually caught my attention too. What was that references? Are we talking about hypermobility with hypermobility like EDS, or there's some other hypermobility?
It could be that actually Dr. Loren received a call yesterday with another one. If you want to speak just briefly to that one too, another type of hypermobility and your engagement with that.
Yeah, hypermobility could mean a lot of things. It depends kind of on the trauma, either physical or emotional, or et cetera, that may have caused it. But the hypermobility that we are talking about in the presentation is that the idea that there becomes nerve issues when there's either hyper or hypomobile joints up in that upper cervical complex, causing changes to that nerve signal or that brainstem flow. And so a lot of things can cause that, either like physical trauma, like you typically hear of like whiplash, car accidents, things like that, or other things like surgery, et cetera, or like emotional trauma, toxic trauma, et cetera, things like that. That's mainly what causes that, either hyper or hypomobility in that area is what we're referencing.
But also, I think you're asking, Melissa, someone that has like Ehlers-Danlos or some other like ligament laxity, someone even like, with pregnancy, you get some laxity with the ligaments too, that kind of a thing. Again, maybe general or full spine chiropractic with, again, the rotary break probably is not something that someone who has fibromyalgia would want to go to. But this technique specifically, or Nuka or Blair, are a lot more gentle and more specific.
Okay.
So the hypermobility wouldn't be an issue with it.
Okay, but for the upper cervical technique too, you're addressing anything from that might have happened from an injury potentially, because we were mentioning just whiplash or things, which is common too. We see that every day in other people as well. But I'm wondering, do you notice the hypermobility quite a bit in a lot of your fibromyalgia patients? Is that something that's kind of distinguishing, or is it across the board? Like we can't distinguish fibromyalgia from other people?
No, that's a great point. It is definitely present with my fibromyalgia patients, but I do have it in a lot of other patients as well. Post, like you were saying, post-car accident with a whiplash experience, or someone who played a lot of sports growing up, or someone with just that genetic disposition. So it is present in fibromyalgia, but I've also seen it elsewhere. It's not solely specific to that. Yeah.
Well, it just piques my curiosity because everybody knows we're always looking for research here or any distinguishing factors for fibromyalgia patients to actually validate that they have fibromyalgia. So this is why I was like asking, is this something that you've been noticing a lot in distinguishing, or maybe this is a way to actually help some of the people that have had physical injuries that led to chronic pain and fibromyalgia as well. But even with the imaging that you mentioned, I'm blanking on the name of I was going to write it down. So what's the name of the device you're using?
Yes. So, well, the one that you can see the 3D model, is that the one you're asking about? The
Both.
CBCT scanner? Or okay,
Let's talk about both. Let's go into both.
The CBCT scanner is it's very similar. A lot of dental offices have it. I'm sure you've seen it where they do the imaging and it goes around you. And then it renders a 3D view, but then it also, as you can see, or as you saw in my presentation, gives those like CT slices. So you can move and maneuver everything around and play within it, and you can see all of the different levels, and it gives you a 2D view, and then the 3D view as well. So you can move the model around and actually see if there's enclosure somewhere or if there's that incorrect motion. Even just from the, like I mentioned in the view, we take that straight view, AP open mouth or AP view right there, and then we also do the lateral. But even just from the AP view, you can see if there's already laterality happening, translation, shifting, and then with the lateral, it just confirms that, okay, yeah, atlas is not moving at all this direction, or your axis is kind of rotated, or there's kind of shifts. And again, everybody's body has a different position response to it. And then that gives us the, okay, this is the correction that needs to be made. This is the one specific movement that we're trying to create. So what you were asking about, the other one, when we do the infrathermography scans and we're measuring how the nervous system is functioning via the paraspinals. So that tool was going up the paraspinals and had a left and right side with a delta T view. And the paraspinals are what hold your back up against gravity at the same rate. So they should be getting the same signal. So it should be a nice straight line. But I'd say 99% of people who come in, there is that like occasional someone who had like an acute injury, and we scan them and they're actually nervous system's clear. They don't need this correction. We send them to a general full spine chiropractor, but majority of people are coming in with chronic conditions already, like fibromyalgia, migraine, sciatica issues. And we'll see that incorrect kind of like looks kind of like a crazy line, and it's not straight at all. And we do a full back view, and we do just the neck view as well. And we do after moving, after resting, we take a lot of those data points up front. And if it looks like that, it's what we call like a pattern. It'll show the same way, present the same way every single time when the person's in that non-adaptive state with their nervous system. So that's what lets us know if they're a candidate and if this care would be beneficial. And if it is, then we do that CBCT view to see what's going on. Why is that scan presenting like that? From that, we're able to see, okay, this is what the correction looks like. And after the correction, we do a post scan as well. And we see if the line's straightening out, if that nervous system's functioning at 100%. Because when your nerves function the way they're supposed to, then your body can function the way it's supposed to. And then that's when your body can heal. It's kind of like, I love analogies, but it's kind of like, I didn't use this one in the presentation. When you see like a 2-year-old that gets a cut and then the next day it's gone, versus like an 80-year-old who gets a cut and then it becomes a wound and it just festers and it never goes away. Why is that? It's not because they're old. I'm sure you like hear that all the time. It's their nervous system's not functioning as well. So they're not getting the healing that their body should be. That's the same thing that's happening with someone with fibromyalgia. Their nervous system's not functioning well, so they're not getting the healing that they're supposed to. But that's how our body heals. So when your nerves function the way they're supposed to, your body can heal the way it's supposed to, and then you function better.
That was great information. I appreciate you answering my question, because again, just anything that is more of a tool that sees what is happening in some way objectively is super helpful. And that's why it piques my curiosity to know if we show up as similar patterns versus someone with migraine, or it overlap, which makes it tricky. But if we sent you, 15 fibromyalgia patients and then 15 with maybe just other conditions, could we distinguish? And that's what piques my curiosity with looking at that. I got really excited. We might get you involved with research.
Love research. I haven't done one on fibromyalgia. I've done one for sensory neurodeflective disorders and migraine case studies, but we have not done fibromyalgia yet. We would love to be involved.
I feel like this type of chiropractor is really important to get the word out, because I feel like when people think of chiropractors, it's just like, oh, it's joints. I'm just going if I have joint issues. So, I mean, that's what I thought of. So to know that, like, if you have nerve problems or even migraines, think about that, then you can go to a chiropractor, but, obviously one that specializes in this. And so definitely getting the word out about you guys and, what you do and everything is going to be helpful for a lot of people.
So true. And that's why I love that you guys are doing this conference, because you're providing so many of the resources to the community that, like you were saying, it's not typical. It's not what you think of. So most people don't even realize that it's an option. And when they do, they have so many other avenues that they could heal within. But if you don't know, then you don't know that that's an option.
Well, I love your pictures and everything in your presentation. I'll explain the nerves and how the nerves are connected to the joints, and even the nerves are connected to temperature regulation. Like, not like I know everything's connected, but just to be able to see that and comprehend is very, very interesting. So
Cool.
And
I'm
it's
glad that it made sense.
yeah.
well, and you provide a comprehensive approach too. So it's a whole body healing as well, which is something that's huge at our community conference. What's ahead for both of you in 2024 for the practice?
Oh, thank you. Thanks. That was a great question. It's not super related to everyone here because it's very local, but we actually just moved our offices. We're having a grand opening in January because they're demoing our old building, and Facebook and Meta is coming in there. So San Diego's a big biotech and tech industry growing space. But grand opening is in the books for January, and then I would love to do research. We didn't do research this last year because we were in the process of moving, but the year prior we had done research, and Dr. Loren is getting really excited also. She's big into the concussions and how the whiplash and that all integrates, obviously because of personal experience. But I think depending on what you guys have going on, fibromyalgia would be a great one for us for this year too.
Mm-hmm.
Well, we would love that. And I know we're going to be creating more content for everybody out there. So please subscribe and then also connect with Dr. Kaci and Dr. Loren on social media. You can see them posting in the chat on YouTube, but we found them through Instagram, and I was very intrigued by this. And then of course they're in San Diego, which I love going to San Diego and going down there and visiting and things like that. It's one of the best places to be, and it's next to water. It's so peaceful.
Mm-hmm.
So that's why I was like, we have to connect and learn more. So we're going to stay connected too, and even having additional conversations, because I know with concussions or just physical injury has been a lot in the past for many of fibromyalgia patients. That is part of my story playing sports. And when some of us got injured back in the day, they did not treat concussions like they do now. And if you are a female athlete, especially, how you might not have been treated for concussions. So I think a concussions discussion is in the future on how to manage that, even as a whole body, like calming the inflammation, what to do, not to ignore it, and where it could lead to for different people. So I'm excited to have those types of discussions.
Yeah.
Thank you guys. Yeah, I've been loving all the other presentations you've had. I was just thinking how much all of this interacts and relates to all of it together. Like every single person's presentation has had something that they all connect to each other, and it makes sense. Obviously, fibromyalgia is the baseline, but it makes sense on how all of the healing modalities as well interrelate, because it's a whole body issue.
Mm-hmm.
Well, and both of you are bringing hope to the community, because many fibromyalgia patients feel dismissed or misunderstood. They don't necessarily feel like practitioners and healthcare professionals really understand them or embrace them. So we are really changing that stigma for the entire patient community and letting them know that there are providers and healthcare professionals out there in your local community. And if we don't necessarily have one yet, we could create training. And I know you have resources of other people that do provide that care, and I'm sure they want to expand as well. So if there's demand, they will expand.
So true. Yes.
And we know you're on social media, so everyone can go follow you guys and look at your content, because you have great content. So even if they're not local where you guys are, where I'm not, but I'm following you guys on Instagram, Facebook. So
great. Yeah, the majority of content is Dr. Loren. She does a phenomenal job with that.
Oh, wow. Okay. So now we know who is behind the social media content.
Yes.
Yeah, I was just going to add really quickly that our main goal obviously is to give people hope and to empower people to know that their body can do the healing and that healing is possible, because so many times people are told or they've gone through many other options and it's not. And so that's the main message we like to portray, whether that's in the office or over social media. Like you were saying, some people might be further away, but if we can just give people an answer in some sort of way or provide some sort of clarity for them, that's ultimately, that's how we're going to change the paradigm of a lot of things in health. And so that's the ultimate goal outside of just what we do in the office. So
I love that. And we're building the community. So healthcare professionals too have their community, and we'll be connecting you to other healthcare professionals we know. They need to know about this as well, because so many people with even primary care, when fibromyalgia gets deferred from them, you might see even the rheumatologist had questions. So any of these resources, if they know, because again, it just gets said chiropractic care. But knowing that there's other subspecialties or there's different services within that to distinguish and help patients in different ways is vital. So thank you so much for your time today. We'll definitely return and have you back in 2024 with other discussions. We can dive in, we can nerd out more on the nervous system.
Love it. That's our favorite.
Well,
Thank you
good,
for
because
having us.
yeah, because my nervous system with being live is way too amped. So we'll connect offline, but we're all about the nervous system today. And I know with Danielle and I being in the live, we get everybody's, with the nervous system, we got to breathe, hold posture. I know, please don't look at our postures right now, because we'll have some fun. So thank you again for your time and joining us today. And we will move you to the backstage. And we're looking for Kelli too
Thank
next.
you guys so much. It's been
Thank
great.
you guys.
Thank you. And please connect with them too in the chat. Follow them. Bye. Okay. We're heading into the stretch. We're looking for Kelli. So let's share a little bit. I have a video actually for Kelli. I was going to do an introduction, but I am maybe sharing. So let me at least do the video for her, Danielle, so we can.
Sounds good.
I'm going to move us back.
Hello and welcome. My name is Kelli and I am a lupus patient. I'm an advocate and the creator of More Than Lupus, a multi-ethnic, multi-generational, and international lupus community. If you're watching this video message, then perhaps you or a loved one was recently diagnosed with lupus or a lupus overlap disease. Now, being a patient-led organization, we understand how overwhelming that news can be. And we want you to know that though this is hard, you are not alone, and we are here to help. More Than Lupus is an inclusive place designed by lupus patients to connect, grow, and inspire you throughout the peaks and the valleys of your lupus journey. Through our support groups, our blogs, our educational events, and informative social media platforms, our focus has been and always will be to give those living with this illness hope and a voice in a world where many still don't understand lupus nor give it the attention it deserves. Additionally, we believe that every person living with lupus, no matter their background, should be treated with equity, dignity, and taken seriously. It is our mission that you feel heard, seen, and valued, because you are so much more than a sum of what is wrong with you. You are more than lupus. For more lupus information and support, we encourage you to visit morethanlupus.com and follow us on Facebook, Instagram, and Twitter.
I love that video from Kelli. And so she's just really inspiring, working at More Than Lupus and collaborating with her as far as patient support services go. She does a lot of advocacy work. So what we're going to do here is we're going to take a pause and we're going to try to get Kelli into the live stream. Hopefully I didn't give her the wrong time. Knowing all my brain fog, you never know with what I do with what's going on. But how is everything going out there with everybody? How are you doing, Danielle? This has been a good day, but it's a good day talking about the nervous system and how we need to take care of our posture and our
Yeah.
muscles and fascia.
Yeah, I think the flow of everything has been great because, we got to talk with Dr. Lenz, but then we got to, relax a little bit and then learn about the nervous system. So I think it's been a great flow of how everything's been going.
I know, and we still have some giveaways to have up. So I think we'll move through because I'm afraid to break the internet, but I am glad that I know with Diva Cassandra has been posting. So it's she won the orbs, and so I think I'm glad that she's here and joining. She's a big supporter of our network and is on our live streams from YouTube. So we value everybody that's tuning in and sharing the content because we have a lot more content to come. Thank you. And more days ahead as well. So if you are just tuning in, we're going to be wrapping up to this portion of Saturday today. And then we'll be moving into our Saturday night live for those of you that enjoy a little bit later of content or dinner time content, depending what time zone you're in. It'll be 9 p.m. Eastern and then 6 p.m. Pacific time. We are having our good friends from Taiwan come in, and I actually have the overlay too. So it is Fibro May and Carrie. You're going to listen to the interview. And then we're also going to have Carrie do some more talks on advocacy. We want to hear their great news about disability that they did in Taiwan. So we're going to talk advocacy, what it's like living with fibromyalgia in Taiwan. Carrie has a wealth of knowledge to share. She has a fibro map because she connects with a lot of the international advocates. So we're excited for tonight. And of course, she is one of our co-hosts as well that will be showing up for some of the fun events that we are trying to coordinate for next Saturday, December 9th, that we are working on. And we'll also have some Pause for Fibro DJ as well show up. We're going to have some fun because this is all to like have fun. We have education. We mix it in with some more fun. And there's a lot of content coming up, Danielle.
I know. Carrie's been great though, sharing everything. We have so many great people sharing all the content out. So we might break the internet in a good way.
Don't say that. People are like, yeah, we are in live production. And so we always advise our guests, although I think I forgot to do that this time, and I need to add it to the deck, everyone, is do not click the duck in StreamYard. So if you are a guest and you are backstage here, that duck, if you click the duck, it will throw you out of StreamYard. So this is going to be our new mascot is a duck, and you'll see the duck interweave through all our content moving ahead.
Just don't touch it, the duck.
Yeah, you especially don't click that duck. Because as many have found out, and it was a funny story because we learned when I did the interview with Carrie last year, she accidentally clicked the duck, sent out, and then while I was telling Brandy, I was like, oh, we figured out don't click the duck. She's like, what do you mean don't click the duck? And she clicked the duck and there she goes. So I'm trying to be strategic with how I deliver the information because it seems like when I say it, I'll be like, oh, this duck. Okay. And then people click it. And I'm like, where'd you go? So it's going to be a lot. I think what we'll do is we'll coordinate another time with Kelli, or if we figure out what time we can like find her replace, maybe she can come back next Saturday too. We will get her back on. I'm glad at least we could showcase her video to all of you and bring some insights to More Than Lupus. I love the work that she's doing. Please go support, follow her channel, follow,
post her website and
okay. Yes. Thank you. I have the links, but I'm afraid again to touch anything because I don't want to drop off. But she does Facebook lives too. And I think she started doing them on Tuesdays, but she's regular with Mondays, Facebook lives. You can follow More Than Lupus and find out more information. She has an in-person support group in Portland, Oregon. And we will be doing a lot of more work with her in the future. Later tonight, as we said, join us 6 p.m. Tomorrow is the matinee with Marco and Carrie at 2 p.m. Eastern. It's going to be streamed all over the internet, including Fibro Life and our Men with Fibromyalgia friends. Shout out to them. Monday, we have Jim from Patients Rising. And then on Wednesday, we'll have surprises on Tuesday, but on Wednesday, we're going to go into some more patient research engagement. Anna's going to help us hack our pain, which I love. She has an app called Pain Freedom. And then Trudy from the Fibromyalgia Canada Association, we're going to talk about how patients can get more engaged in research. We're also going to have a presentation from Anne and Lily, our dynamic duo team who helps with advocacy and how they manage caregiving and living both with chronic illness conditions. We do hear from Lily to give us a youth perspective on what she would like to change. And she has a really interesting perspective on differences compared to congressional leaders versus medical physicians. I love her insights, and she loves to share science. So I'm so glad she could join us on Wednesday. Then Thursday, we're going to have Michelle. Shout out to Michelle from Turning Pain into Strength. She has a book that we will be giving away as well in the conference. And I'm really excited for her advocacy work and to have her share on caregiving and her healing journey. We have Julie, who's going to present on chronic illness at work. She also has a book. So stay tuned for these giveaways, because we're going to be giving copies away of people's books, because we know it's important to have this on the bookshelf. Friday, we're up again. Danielle, it's early, but this is good. We have pediatric pain from US Pain Foundation and their provider speaker. So I'm glad we get to talk more about pediatric pain at this.
Yeah, that's going to be great. Oh.
And Dr. Salebi is going to speak on LDN and the cannabis connection. So that's going to be a lot. We're going to have a lot of questions for him. Many people ask those questions, especially about LDN and how to utilize that. So that's going to be on Friday at 11 a.m. Eastern. I'm trying to get my times right, and I'm just going to stay in Eastern time rather than convert and get everybody confused. And then after he speaks, we have a dear colleague of mine who is amazing, Coach Wendy. She's going to be presenting too, and we work together for group health coaching. And I love her spirit, and she's definitely reclaimed her health from autoimmune conditions. We're going to hear from Anquinette from Freddie J's Fibro Fighters, and then veteran voices for fibromyalgia will take over the stage. I'm excited to see Crystal and her friends. She has a great interviews planned. So Friday is going to be there. Pause for Fibro. Of course, you're going to be there on Friday. Saturday too. Again, we have a 10-day conference planned. So this is a lot of content I'm going through. Please stay posted, ask your questions. Dale is going to be sharing how he finds his creative outlets with his photography. If anyone is a part of the Fibro Connect group or wants to join, we'll have to share a link with that. He has amazing photography skills. He shares it with the group. We'll make sure to share his link because we're going to be talking to him. He'll be streaming in from the UK. We also have a presentation from Arushi from the India Fibromyalgia Foundation. So we have a lot of international friends that will be streaming. And then Dr. Ginevra is also on Saturday. So she's going to be presenting some more about research with a live Q&A too. And there's some surprise guests that we're still working on. Dr. Ron is also working on his presentation. So we're going to figure out too where Dr. Ron and the Texas Center for Lifestyle Medicine team will be coming in. Shout out to Swing Care and Inspire. Everybody out there for supporting this conference. We really appreciate you. So we are going to close out.
And Saturday night, right?
Oh, yes, but it's the
this
concert,
Saturday.
Right? No. December 9th is the rock concert. Is it a music concert or rock concert?
Both.
Okay, well, we have it's a combination of music trivia and rock music. I don't want to. We need Carrie. Carrie is the host.
We need Carrie.
Carrie is hosting this event, and this is going to be on December 9th. We're figuring out the logistics a little bit, and we're going to talk about it more. We need Carrie to rest and take care because we're going to see her tonight, and then we need to give her time to rest, and then we'll catch up with her and give you all the information. So that way everybody can also have enjoyment. You'll get days full of education. and then you'll enjoy some of this too. So thank you, everyone. I know I am frozen, so it is time to end and close out. Thank you again. We will see you tomorrow at 2 p.m. Eastern for the matinee presentation with Marco and Carrie. Thank you, everyone. Bye.
Bye.
Life lessons come one in a dozen. The other 11 get something from nothing. Life lessons come one in a dozen. The other 11 get something from nothing. Life lessons come one in a dozen. The other 11 get something from nothing. Life changes, just open the door. One thing's certain, I'll always be yours. Myself wondering what did happen to the last 10. I ran away with my life, fast forward, never turn back again. It's kind of funny that the more we pass time, the more we need to set them rewind. And 19 was the year I had to leave you, but now I'm seeing all the signs. Is this really happening? I can't believe it's true. I'm just as surprised as you. This really happening? I can't be too sure, but one day I'll be yours again. Life lessons come one in a dozen. The other 11 get something from nothing. I sit here looking for an answer. Maybe the biggest question was in the last chapter. You gave me the soul I have today. Without you I never could have moved away. But now I see what you teach. I do believe I always should have stayed. Yeah. Is this really happening? I can't believe it's true. I'm just as surprised as you. Is this really happening? I can't be too sure, but one day I'll be yours. dozen. The other 11 get something from nothing. Life changes, just open the door. One thing certain, I'll always be yours.